The Cuyahoga County Committee of the Whole budget hearing for Monday, November 10th, 2025 will please come to order, and the clerk will call the roll.
Good afternoon, everyone. As a reminder to all meeting attendees seeking parking validation for tonight's meeting, please be sure to scan the QR code located on the back table near the chamber's entrance to claim your discount. If you do not already have a Metropolis account, you will need your license plate number to set up the account in advance of receiving your validation. Please be sure to complete this prior to the end of today's meeting, as the QR code will be removed at the conclusion of the meeting. Also, as a reminder to all in attendance, this meeting is being recorded and live streamed on the county's YouTube page. It is now 1:07 p.m. Calling the roll. Mr. Kelly. Here. Mr. Sweeney.
Present.
Mr. Castleberry. Mr. Castleberry is absent at the moment. Mr. Gallagher.
Here.
Mr. Schlepper.
Here.
Ms. Conwell.
Present.
Mr. Jones is absent at the moment. Ms. Turner.
Present.
Mr. Hauser.
Here.
Ms. Simon is absent at the moment. Council President Miller.
Here.
You have a quorum.
Thank you very much. And the next item on the agenda is public comment. Do we have anybody signed in?
Yes. Lou?
Good afternoon, everybody.
Good afternoon.
Lou is here to support the funding for Metro Health. That's the most important thing today. Metro Health is our county healthcare systems supporting the county to serve all residents in Cuyahoga County. Especially, I have to appreciate Metro Health actually made the extra effort to even support health care for the unhoused population and extreme low-income population as well. The mobile clinic to come to the shelter sites and permanent supportive housing, those locations are extremely important, because these people are the ones having very little access and means to have access to health care once they go into homelessness due to poverty. Why? Even you stay in the shelter, it's not that easy to even get a bus pass to go to your doctor appointments. So having primary care at least to come to these places to help people out actually is to preserve the population, even the workforce for the county. If we do not do all these important things, Metro Health, healthcare, and Health and Human Services, we will only continue losing populations. What will happen to the future of this county? It will be dark. It will be scary, because we will only have the sick people, poor people left here. How can we get our Gloria days back? We need to thrive, so we need health care. Everybody needs that. With the federal legislation cutting all these things, we definitely need all the local supports and actions we can get. Thank you.
John Moss.
Good afternoon. My name is John Moss. I've been on the Metro Board for 15 and a half years. I've chaired the Finance Committee for about 8 years. And I only have 3 things to say that we all know. 1, we all know that you're in a tough spot. 2, we know that you care about Metro Health. And 3, we know with the recent big, beautiful bill, there's $400 billion that's going to be cut from primarily Medicaid. And you know that Medicaid is our bread and butter. And I say that all because I know we're all in this together. But we cannot maintain our services that we want to have without your help. So I'm just here to ask today for your help. Thank you.
Good job.
John Corlett.
Good
Good afternoon, everybody. My name's John Corlett, and I am proud to serve on the Metro Health Board of Trustees. You know, as a former state Medicaid director during the Great Recession, I understand the fiscal environment that the county is facing. Every department is being asked to make sacrifices, make tough choices, and we respect that. But we ask that Metro Health's role as a public hospital and as a lifeline for our community be protected. Metro Health is the only remaining urban county chartered public hospital in the state of Ohio. We serve more than 300,000 patients a year, and 2/3 of our patients are either uninsured, on Medicare, or Medicaid. We care for people in jails, foster care, schools, shelters, and homes. We are part of the fabric of Cuyahoga County. At the same time, Metro Health faces enormous headwinds at the federal and state level. Unless Congress acts, and they seem to be getting on the mood of acting these days, 52,000 Cuyahoga County residents will lose federal tax credits that allows them to purchase health insurance. And at least 11,000 of them are very likely to become uninsured as a result. Federal law also requires $43 billion cuts in Medicare after January 1, the largest cuts in the history of the program as a result of HR 1. And we already know that the big, beautiful bill, as it's sometimes called, cuts $1 trillion out of Medicaid over the next decade. Thousands of our local residents will become uninsured. They will lose coverage. And all these newly uninsured will most likely end up on the doorstep of Metro Health. We're tightening costs, consolidating services, and helping patients maintain coverage, but we can't do it alone. We ask that the county maintain Metro Health's current funding levels to help us fulfill our mission, caring for everyone regardless of their ability to pay. And I want to thank you for your time. I want to thank you for your public service. Thank you.
Jody Mitchell.
Good afternoon, Madam Chair and members of the Finance Committee. I'm Jody Mitchell, Senior Director of Policy at WellLink, formerly known as the Center for Health Affairs, and I lead the Northeast Ohio Opioid Consortium. We share your concern about the difficult budget choices before you. Reductions in funding for critical social services and health programs will have a deep impact on the well-being of our community. WellLink remains committed to serving as a convener and an innovator, building shared services and strengthening collaboration. The goal of the Opioid Consortium is to unite efforts to address substance use disorder and reduce the stigma that continues to surround it. The consortium brings together hospitals, community organizations, public health agencies, recovery partners across the region. Together, we share and implement evidence-based practices, promote policy change, support treatment and recovery, and enhance prevention efforts. This collaboration was built over years of work by community leaders who were determined to reduce the devastating effects of the opioid crisis in Northeast Ohio. The Opioid Consortium is a subgrantee of the Cuyahoga County Board of Health Opioid Data to Action Grant from the Centers for Disease Control and Prevention. This partnership uses data to tailor prevention strategies, ensures culturally relevant interventions, and strengthens the local overdose response through multi-sector collaboration. As part of this effort, the consortium hosts bi-monthly education series, community convenings, and publishes monthly Consortium Chronicle newsletters. We also align closely with the U.S. Attorney's Heroin and Opioid Action Plan, supporting the committee work across law enforcement, prevention, treatment, recovery, research, community organizations under a collective impact model. While we've seen a decrease in the number of overdose deaths, we have seen an increase in emergency room visits with suspected drug overdoses. Thank you.
Jay Williams.
Good afternoon to this distinguished board. I'm here for
Mr. Williams, if you could state your name for the record, please.
Jay Williams, and I'm standing here with Pastor Jimmy Gates. I'm here on behalf of the underprivileged. I'm here for those that when trauma happens, they go past Cleveland Clinic they go past University and they end up at Metro. I'm here for the burn victim that go past Cleveland Clinic, that go past University and get to Metro. I'm here for those that just don't have no money. And I hope that all of you take time out and just think about what's getting ready to happen, because all of the hospitals, once that were open, are closed. And they take us past everywhere to Metro. Metro has the best burn center. They have the best trauma center. And we know that because we have people that actually get shot, people that get burned. And it hurts us if any money is taken away. I beseech you, I stand pleading with you. Don't do it. Just think about the people that just can't get no medical attention. That's my prayer. I hope you all will consider that in your messing with numbers, because that's what you have to do, and I respect that. But we're hurting. Every time somebody gets shot, they go to Metro. Every time somebody in a burn, they go to Metro.
Gail Long.
President Miller, Chair Turner, and members of Cuyahoga County Council. My name is Gail Long, and I am a taxpayer in Cuyahoga County and a patient of the Metro Health System. As I have said to you in the past, I believe our Metro Health System is one of Cuyahoga County's finest and most valuable assets. We cannot allow it to crumble. I urge this body to not make any cuts to the system's current subsidy of $35 million. Though this subsidy is a significant amount of money, it is not kept up with inflation and should probably be increased. I do not agree with the changes that Metro Health has made to its uncompensated care policy, but one can see why it took that step. Metro Health cannot maintain its financial health when it loses $1 million a day providing uncompensated care. And yet to come are still the changes from the federal government that will threaten not just the system, but patients receiving Medicaid and Medicare. Healthcare is not a right in this country. It is, in fact, a privilege for those who can afford to pay for it. Metro Health sees all, regardless of their ability to pay, and provides high-quality care for all of us who walk through its doors. We absolutely cannot weaken the ability of Metro Health to continue providing high-quality care and to everyone, regardless of their ability to pay. Do not cut their subsidy. Thank you.
That concludes the public comment portion for today's meeting.
Thank you very much, and I now turn the gavel over to Finance and Budget Chair Meredith Turner to lead the budget hearing.
Thank you, Council President. Good afternoon, colleagues, staff, directors, members of the public. We reconvene today in the Committee of the Whole to continue our review of the 2026-2027 biennial budget. The departments presenting this afternoon represent core services that touch residents every single day, from public health and safety to community development to environmental stewardship and planning for our region's future. We appreciate the time and preparation that each presenter has brought to this process, and in the interest of keeping our conversations clear and focused, we ask that each department highlight key operational priorities, staffing needs, service outcomes, and any major changes from prior years. We will begin with the Metro Health System. Dr. Alexander. Madam Clerk, would you please call the item?
Resolution 2025-0293, adopting the 2026-2027 biennial operating budget and capital improvements program. And for the record, Ms. Simon is in attendance.
Doctor, before you begin, I just wanted to outline who's coming next. We'll hear from Public Safety and Justice Services, followed by the Office of Violence Prevention, Clerk of Courts, Office of the Medical Examiner, Department of Development, Housing and Community Development, County Planning Commission, Soil and Water Conservation District, Department of Sustainability, Public Works, Green Energy Public Utility, and I think that wraps up our, Mike Foley will be the last presenter today. Dr. Alexander, do you have anyone with you that you want to bring up or acknowledge?
I think for now, Madam Chair, I'll start with the presentation, but if there are any questions that necessitate any of our other executives, we'll bring them up then. So,
Thank you. Floor is yours.
thank you. Good afternoon, President Miller, Chair Turner, members of council. I'm Christine Alexander Rager, and I'm the President and CEO of the Metro Health System. I begin today looking back that it's been a year since I was last with you, and it's been just a smidge over a year since I stepped into this role as the CEO of Metro Health, a role that I feel deeply passionate about, and I am so proud to be with you today to share information on how we are doing as a system in 25 and to look forward to what we can accomplish together in 26. You see a picture of the many things that we provide to our community here, whether it is life-saving care, whether it's the birth of a new child, an expansion of family, or it's taking care of somebody after an injury. We truly provide cutting-edge, innovative care. And what you don't see here are some of the ways in which we're actually nationally renowned. I think everyone knows about our Level 1 Trauma Center. Everyone knows about our burn services. But do you know we are one of 18 hospitals in the entire country that is recognized for our informatics work? Now, just to give you perspective, there are thousands of hospitals across this country. There are many wonderful hospitals in our city and our state. We are the only one in Northeast Ohio to achieve this Level 10 status, and only one of 2 in Ohio. So pointing that out to you, our physical medicine and rehab program, #1 in the country for research. So there are ways in which we innovate with the idea of what you see here, being there for our patients and being better at it. And we continue to grow. Despite the challenges that you are well aware of, we continue to grow in significant ways. Our prescriptions filled up 14%. That's almost unheard of. And that truly is in response to what the community is asking of us as others, pharmacies have left the region. Emergency room visits are up. Our total outpatient visits are up. I'll let you read through those, but across the board, we've had growth, and I'm really proud of that growth. It's a sign that our community really believes in us. But unfortunately, we've also seen growth in cost, and we're not unique in this. Every hospital in the country is facing it. Every business is facing it. But what you see here are the costs of everyday things, the medical supplies to take care of our patients, our pharmaceuticals, and then, of course, our growth in charity care, which was up 90 million is what we're projecting for this year compared to last year, and we're expecting another 80 million in growth in 2026. And just a graphic to demonstrate this to you, in 2022, we were at $176 million. We are on track to end this year at approximately 367 million, with the increase to 446 million in charity care. Those are unprecedented levels, and actually exceed what happened in the Great Recession. And a look district by district, which gives you the idea of the numbers of patients served and the amount of uncompensated care that's delivered. And just for note, this carries us through the end of September. So this isn't a projection toward the end of the year, but this is actual data. So of course, this led us to take action, and I know many of you are aware of the actions that we took to right the ship. We had a reduction in force, we had a hiring freeze. We looked at our geographic footprint and decided that there were offices in places that could blend with other offices and allow a redistribution of staff across our system. This has allowed us to expand into evening hours that our patients so desperately need. Ever since COVID, we haven't been able to provide evening hours just from people leaving the workforce because of the changes that COVID brought about. So we now can get back to those evening hours that make it much more convenient to engage in healthcare. We literally are looking at every single program and every single department across our institution, and we're looking at it through the lens of, is this something that is mission critical? Is this something that is important but perhaps not critical and maybe could be done in a more efficient or effective way? Or is this something that is good to have for patients but just a luxury we can't afford right now? And we're making our decisions based on that, again, putting the patient at the center of each and every decision. We also have looked at our financial assistance plan, which we have renamed our Healthcare Access and Assistance Plan, because patients would like access to care, but there's a huge stigma to being denoted as charity care or an uncompensated case. So if patients aren't eligible for Medicaid or for whatever reason can't sign up in the marketplace, we have the opportunity and the pathway for them to engage in care with us. So by changing that plan and updating it, we are hoping to get people more engaged with their care. And we're talking to our community about this. We're reaching out to the community so we can do everything we can to help them get signed up for insurance if they're eligible or for our healthcare access plan. And we're doing this through community engagement and health fairs. So instead of the larger health fairs that we were known for, we are now hosting smaller health fairs in communities, and we're combining that health fair with the opportunity to get signed up for coverage. We have our very first one coming up this Saturday. We have another one in December and a third in January, with, again, enticing patients to come in, get screened for common diseases, potentially get signed up for coverage, and get signed up for appointments to follow through. And now this takes us to the 26 budget. So if you look at the very first line on the budget, you'll see our total operating revenue. And just for reference, we did post the most recent prior years, looking at 22, 23, and 24. What you see for 25 is where we are proposed to end the year, and then in 26 is what we have budgeted. Our operating expenses, and you see, by the way, that we're a little over $2 billion for what we anticipate in revenue. And that sounds really great until you look a little further down and you see our expenses. We are also budgeted to be over $2 billion. In fact, slightly over $2.3 billion when we end the year. So again, our expenses will outpace our revenues. Including in there are things like the salary, benefits, and wages, but please note the depreciation, amortization, and interest, and see how that has increased over time, and that relates to us opening the new hospital, the Glick Center, and the opening of a new outpatient health center. So that's why you're seeing that spike in that line in particular. When you look at the operating loss for the year, we will end up in roughly $31 million to the negative. A piece of that, however, a significant piece, is dollars put toward taking down the towers. Taking down the towers is a 2-year project. Excuse me. So this would be the first of those 2 years, and those dollars can't come from capital expenses. Those have to come from operating funds. So if we removed the dollars for that, if you looked just at our operating expenses, our loss would be closer to 19 million. So that's a significant improvement if you look at where we ended the year last year at about $40 million negative, and where we are proposed to end this year at 48 million negative. So clearly, all of the things that we showed on the previous slide are starting to have some impact, but we are not yet to break even, and we are expecting further increases in need from the community for charity care and uncompensated care. I do want to call your attention to the operating loss that's in the green. We did a lot of talking over the last few years of EBITDA, and that's in the shaded area just below the operating losses. EBITDA is an estimation of your cash on hand, and we felt like that was a bit more misleading. It's an accounting term, so now we're really refocusing our attention on operating losses and margin. So just want to point that out to you. A few words on our capital budget. Again, I mentioned there are some projects that start in one year and end in another. There are projects that will just be self-contained to 26. And so the very top line that you see in the right-hand box are routine, required, and strategic investments. The investment in the outpatient health center that will open up in 26, and then the completion of prior year projects, and that gets us to 72 million. And even at that 72 million, this doesn't allow us to get ahead of replacing things before they break or replacing things before they outlive their useful years. It really is just skimming the surface. And if you look, there's a breakdown in the order of priorities of how we prioritize those capital requests. And this is a look at the support from the Health and Human Services levy over time. And we deeply appreciate the support that we get from you as a result of the Health and Human Services levy. We are deeply appreciative to all of the taxpayers that first vote for this levy and then pay the taxes that support it. If you look over time, the dollars that we get from this levy have been relatively steady from 2007 until today. There's been some increases, there's been some decreases, but they're roughly in the same ballpark. What has changed over time is the value of the dollar. Right? Costs are going up and the dollars don't cover what they once did. And so if you look in 2007, where we were at 36 million, if you put that into today's dollars, that would actually be $52.6 million. So the dollar just isn't covering what it once did. Looking at it another way, if you look at the pie of what did the levy provide in terms of a percentage of our operating budget? In 2007, that was just a little above 6%. By today's value, it's 1.7%. So we have a request of you. Actually, we have a few. But the first request is that our current subsidy be maintained at 35 million. I understand you have a lot of demands, and I know times are hard and there are challenging decisions to be made. We felt the same when we put together our 26 budget. But if there is a way that you could continue our subsidy, know that that would be well received by the patients of our community. A cut to $32 million means roughly 1,000 members of our community will not have the subsidy to cover their health care and their prescriptions. So we would respectfully ask to continue at the current level. We also ask that you help us spread the word on our community health events and community enrollment events. We can get you the dates and the places. Again, the first one is this Saturday, and it's at our Broadway Family Health Center. If you could get your constituents there to participate, that would be fantastic. And if you have time in your schedule and you want to come join us, we would be deeply honored to have you there with us. And just to bring things to a close on a more happy note, I mentioned the Outpatient Health Center that will open up. This is a tremendous facility and will be a game changer for our community. It is 300,000 square feet. And this was changed mid-project to be able to meet the needs of the community. Thank you so much. It was once intended to be partly administrative and partly clinical, but after the COVID pandemic, we recognized that our patients needed an entirely new clinical space, and this project was pivoted to become that space that will provide life-changing, life-sustaining care to our community. An important feature of it, though, that is available to everyone, whether you're a Metro Health patient or not, will be our pharmacy that will be open 24 hours a day, 7 days a week with drive-through service. Again, a response in what our community needs. So even if a patient is not a patient of Metro Health, they can use that pharmacy. So with that, I'll conclude my presentation and take your questions, along with offering my gratitude for listening to the presentation today and for all the ways we partner together.
Okay. Thank you, Dr. Alexander. We'll start with Chairwoman of our Health, Human Services, and Aging Department, Ms. Conwell.
Thank you, Madam Chair. To the CEO and President, on slide, I guess it's slide 6, I just wanted some clarification. That's where you have the patient served and the uncompensated care. I've noticed that four of those districts are relatively high in terms of patients served, but I'm not understanding why is the uncompensated care more in some that don't have less than.
So when we look at uncompensated care encompasses a couple of different things, and there's a formula that we use to calculate uncompensated care, a piece of which is what would normally be called charity care. So that are those patients who have absolutely no coverage. And then there are others who have inadequate coverage or, have a plan that they can't really afford, right? So uncompensated care pulls all of that together following a validated formula. In some areas, you just will have some areas in the county that will have a higher density of patients that don't have access to health insurance coverage. And it does vary by community, but it also varies by that formula of where they may fall into something that is more, uncompensated because they are underinsured as opposed to completely uninsured.
Gotcha. Okay. I think my second question was on slide 10. When you talk about taking down the towers will take 2 years.
Yes.
Has the following or the last two columns, which is 2025P and 2026B, are those the 2 years where the towers are being taken down? So I'm assuming currently, because I'm looking at the operating loss income is high in both of those years.
So thank you for the question. Actually, it would be the 2 years of 26 and 27. So the operating losses from 24 and 25 were the dramatic growth in charity care. That's the largest contributor to the losses in 24 and 25.
And just a side note, and just in your thought process, so you spoke about the increase of cost, whether it's uncompensated care or just overall for the hospital. How do you, so if you ask us today to keep it at 35 million for the uncompensated care, but still in your charts, you're showing an increase going up. So how are you combating that on your side? Even if we kept it at 35, which, how are you making up for these differences that you're still seeing the increases?
So thank you for that question. And that gets back to the earlier slide that went through everything that we've been doing this past year and setting ourselves up for in '26. So we had the reduction in force, we had the consolidation of clinics. We continue to look at programs to say, how can we make this more efficient? How can we make it more effective? Is there anybody else in the community already doing this work that we can partner with them to do that work? That's starting to have an impact for us. If you look at our FTEs, so that those, that relates to the reduction in force, where we had a decrease in those this year, but we also have a very rigorous process for position approval. And you will see that this year we have a lower FTE than what we are projecting, because we expect that there will be some critical positions that we will need to fill, and we want to be able to give ourselves a little bit of room to do that. But what we projected is roughly where we're at right now. But we will continue to look at positions to say, again, is this mission critical? Is this something important to have? Or is this a position that's good to have but something we can't afford? So the list on slide, let's see, it would be, hold on. In your pack that says we're taking actions to get our financial house in order. That's the list of all of the things that we have worked on this year, but will continue to work on in the coming year to say, how can we continue to push to become more efficient, continue to partner, continue to do this work of maintaining our financial responsibility in the face of the increased costs that we know are coming our way.
And I guess my final question is that, possibly this round would be in terms of, doesn't have a slide number, but we are also seeing soaring costs. So pharmaceutical cost is a problem for the county as well as I see for your hospital. Do you guys have lobbyists, that are working to try to help you on the federal level? I think we all need to work together on that and the pharmaceutical costs. They're really throwing all of our budgets out of whack.
Correct. And pharmaceutical costs, it's a little bit of a complicated issue, but we are advocating constantly around pharmaceutical costs. One of the things that's contributing to our pharmaceutical cost is the fact that the pharmacies have closed in the community, so we're taking on the responsibility of providing pharmaceuticals to the community in a much greater way year over year. So some of it is the pure cost of the medication, but some of it is just the large number of patients that we're seeing. But we are advocating and would be happy to figure out ways to partner around that.
Mr. Kelly?
Thank you, Madam Chair. Hello, Dr. Alexander.
Hello.
Question, what is included in the $163 million of year-to-date uncompensated care versus $367 million of charity care?
So that, again, that relates a bit to the formula that we use. So for charity care is for patients that have absolutely no coverage at all. Uncompensated care encompasses charity care plus others, for instance, folks that might have a Marketplace account that has a very low premium but a high deductible, and then they can't pay the deductible. So that's a piece of what becomes uncompensated care. It's not fully charity care because they do have some coverage. There are other ways in which patients come to us having limited coverage from other sources, but then the larger part of that, the bill, is uncompensated. So I know it is a little confusing, and sometimes we also talk about charges versus cost. Charge is what we charge for the care that we provide, right? You go somewhere, you get a charge for that service, right? Cost is what it costs to provide that direct patient care service. So that's the cost of the doctors, the nurses, the supplies, right? So that's the difference between the two, is that charges are the amount that we charge. That's what we charge to our insurance. That's what we charge across the board. The cost is the direct cost of providing the care. Does that make sense?
Yes.
Okay.
All right. If I may continue. So what is driving the exponential increase in charity care? Is it the result of increased cost of the care, as you just said, the number of patients served, personnel expenditure, or something else?
The biggest contribution to what we're seeing in uncompensated care is the growing number of patients who do not have coverage. When we look at the numbers, that's the most significant contribution to our uncompensated care are patients without coverage. Second to that, I would say it's the increase in cost of, medical supplies, pharmaceuticals, the cost for workforce, coming out of COVID. So many workers left the workforce, and then it became a greater competition to get the workers that we need within healthcare, and that became a little bit of a wage war, if you will. So the costs did definitely go up for that. But when we drill down and look at this, it really is just the growing number of patients who have no coverage. They're no longer eligible for Medicaid, and either can't afford the marketplace or are in the marketplace but have a deductible that they can't afford.
I think one of the questions I have in some of this, is there any elective care that's involved in any of these costs, or is this, is there things being done there that are more, would be considered an elective versus, I guess, necessary?
We would have to drill down and look at that, because when we think of elective, for instance, someone that needs a knee replacement that is no longer ambulatory or struggles to be ambulatory, can't get to work, a knee replacement is an elective procedure, right? But to someone who's unable to work because they have such severe arthritis, a knee replacement is really critical to their livelihood. So I think it's hard to define that line between, life-sustaining versus elective. But we could take a crack at it and take a look at it and get back to you.
Thank you, Madam Chair. Thank you, Dr. Alexander.
You're welcome.
Ms. Simon?
Thank you, Madam Chair. Good afternoon, Doctor. We're in an environment right now, it's a perfect storm. We're going to see the ACA cuts. We see costs going up. And the question was asked, what is Metro doing? I'm not sure what, if anything, more Metro can do considering the environment and the climate we're in right now. Do you agree with that?
I would agree with that, but also I think that we are willing to look at any other opportunities to improve revenue streams.
We need truth. We need the facts. Right now, you need revenue streams, right? And I understood after you were here last time that the council voted to spend $7 million out of our opiate money to go to a competitor, and that you announced right after that you're going to be closing the District 10 ED, Psych ED. Do you that happened, correct?
Correct. We'll close at the end
and there's
of
a
December.
narrative, Doctor, going on that you would plan to close that, and even though you stood before us that day and said that was not the plan, that you said very clearly that if council voted this way, that you would have to close the unit. Is that correct?
That's correct.
And you also received a cut from the Adams Board, correct? They diverted money away from Metro.
Correct. The plan is to take the subsidy that we have currently and give that to the centers. That's what we were notified of.
Okay. So now you're facing another cut from the county executive's budget of $3 million. Yes?
Correct.
And my question is, considering all these things that have happened in the last 2 months, these cuts and the federal climate, the state climate, is the uncompensated care program we have today even sustainable for this hospital to continue if you continue to see this trend? If this council votes not to restore 3 or not even more than 3 that's needed, what do you anticipate happening with regard to this charity care that I hold so sacred as a council person?
So I would have to say that we hold that charity care very sacred as well. And the times are challenging. And we are facing cuts, but we also have a strong belief in ourselves as a system that we've weathered many storms. We've been around for almost 200 years, and we believe that we can weather the storm. However, that being said, We do have to continue to get our financial house in order. We do still have to continue to look at what efficiencies we can create, what we can do within our four walls to make sure that we're doing everything we can to be sustainable, to focus on those patients with the greatest need. And then from there, to continue to partner with the county, with the state, with the federal government to create whatever additional revenue streams can be created so that we can continue to provide the charity care that's so sacred to who we are.
What if that doesn't happen, doctor? I know that's a vision you have, that revenue is going to be coming in to do, what if that doesn't happen? Is this sustainable? I mean, you're looking at all these options, but I truly need to understand what's going to happen to the charity care if these things, if we continue down the trend we're on now. Even though you're looking, I know you're doing everything, and you always say that when you're at the podium, the hospital and the board's doing everything they can, but that sometimes isn't enough when what we're facing with the federal government, the state, and even these county cuts.
So, of course, if we continue to have millions and millions of dollars, negative, I mean, that would put us in a very precarious situation. And we have a very large mortgage that we have to pay for the Glick Center. We are opening up the outpatient health center. There are some costs associated with that, although we did take investment of our own dollars into that center. We do have cash in reserves, but we want to not lean on that cash in reserves if we don't have to, because we have to maintain at a certain level, because we don't want to default on the bonds and our bond covenant. So we are trying to very carefully manage that, manage our cash, manage our investment so that we keep that cash in reserve at a level that we need it to be in order to not violate our covenant. With all of that being considered and what we're anticipating for 26, that's where we come before you with a budget that would still be negative, though far less negative. And if we look at the 25 budget, where we're going to land this year is a bit less than where we landed last year, but it is a significant improvement of where we were after first quarter. After first quarter, we were projected to be nearly double that amount. And with what we did internally, we got ourselves to this projected negative 48 million. For next year, we're including what it's going to cost us to take down the towers, but there's return on that investment, because right now we put about $5 million a year into just maintaining the towers, even though we don't use them. So there is return on that investment that we will see the benefit of that. Based on the 26 budget in 27, we should be at break even. So despite all of these headwinds, we actually are making headway financially. I know it doesn't sound that way when you look at the numbers that I'm putting before you. The subsidy from the county is critical. If that were to go away, that could be very devastating. But I'm not hearing a signal that that's going away. I'm hearing about a reduction, and we built that into this current budget, a reduction. And we will continue to look at other ways to create funding streams. There are hospitals around the country that are closing, and of course, is there a threat? I think every hospital in the country is thinking about that right now. We're no different than that. But despite these headwinds, we feel like we have a solid plan, but we do need help. We do need assistance. And that's why we're here before you asking not to be cut. It's why we're meeting with leaders of the state. It's why we're meeting with folks federally, because we really want to avail ourselves of any opportunity, of any additional revenue stream that we can access that can help us provide this life-saving care for our patients.
Thank you. Is there going to be a cost? Are you taking down the psych unit in District 10? What's going to happen to that space?
So let me add clarity. The psych unit that is closing is the psych emergency room. It is not part of the psychiatric hospital. It is separate and distinct. So there's the behavioral health hospital that is on the same campus and attached, but the psychiatric emergency room is a ward immediately adjacent to our regular emergency room. So that space is still going to be there. We are not staffing it as a psychiatric emergency room any longer. We are using those resources across our institution, including in other emergency rooms, so that the staff that's working there will pivot into jobs across our other emergency rooms and in the hospital, so that they'll lend their expertise to the psychiatric patients. We will still be able to use that space if needed, and we're working our way through our plans for that space. But that's part of our emergency room services. That was the psychiatric emergency room. So I just wanted to provide that clarity. It is not a closure of the behavioral health hospital by any means. This is the psychiatric emergency room that we opened just a year ago. And that is where the staff will pivot across the institution. It will allow us to take care of psychiatric patients in our other medical emergency rooms, but also we have our staff spread throughout outpatient offices, not just at Cleveland Heights, but across the county, where patients will be able to come in for care as well. Does that clarify?
No, I understood. There's a
Okay.
difference between the two. I just wanted to know what happened to what's
Yes.
going to happen to the space. Thank you.
Thank you.
Okay, Mr. Gallagher.
Welcome, Doctor.
Thank you.
I just want to start by saying our process is to have this, we get the budget from the executive, the council goes over it, and then we do amendments. In good times, there's lots of amendments to add and subtract and move things. And I've talked to a couple of my colleagues, and hopefully along with everybody up here, once they see my plan, intend to amend this budget, returning you in 26 to 36 million and 27 to 36 million for a total of 6.5 million. It's not a panacea. It's 26 and 27. We still have probably heartache in 28, 29, but let's deal with what we have to deal with at hand. And again, I've talked to a couple, and I intend to talk to everybody, and hopefully that's met with enthusiasm regarding returning you to where you should be. I personally would go back to the 40, but I know there was an agreement in 13 because of the building of the hospital, so I think it's only fair to maintain where you're at. I'm reminded of a statement when I first started here, and while I was in the county work and I was a state employee, and I knew the importance of Metro, but I really didn't know the importance of Metro. And at the time, Metro was having some troubles. Their board was a mess, yet nobody paid the price, but the county commissioners paid the price with their scandals. And we ended up here. But Dan Brady reminded me and other people on council at the time, he goes, Mike, you can cut and you can trim, but you don't touch Metro. And you got touched. And that's unacceptable. And I hope my colleagues agree with me that that's unacceptable, even though these are difficult times. And we all understand that. I've never seen anything like this in my days. And I've been in elected office for 26 years. Some might suggest that's maybe 25 too many. I want to go to what Councilwoman Simon was saying. And I still can't get it out of my head with the psych ED. And I know it's done. What's done is done. But right after that, you testified, and when you're testifying in front of us, you're under oath. So you testified under oath in front of us, told us very calmly and directly what unfortunately would happen if indeed we voted to do what we voted to do. Soon thereafter, you were stuck with a decision, and you made the decision. And on October 17th, the Plain Dealer came out with an article. And I won't tell you what the behind-the-scenes comments about you and Metro were, and the board. Although at our meeting on the 23rd, oh, by the way, board members that are here, that's a meeting you should have been at. You should have been at. That's your job. And I got a feeling I know why you weren't here. But this came out in the plain dealer, and and just tell me if this would be fair to say. And it's your knowledge that if somebody said, disputing what you did, that according to some people, discussions with board members, that you were going to all along close down that psych ED, regardless of what we did and how we voted. Is that true?
So thank you for the question. Again, I think so first off, no, that's not true, but I think that there is continually confusion between the behavioral health hospital and the psychiatric emergency room. I think that there is confusion between those two. I never had a plan to close the psychiatric emergency room. We had just opened it a year ago, and we opened it in response to St. Vincent's emergency room closing and felt that that was part of our commitment to our community to open that up to provide access to the community of psychiatric emergency room services. But again, related to financial strain, and if there's another place that's going to be offering the same exact services,
Right.
and if the funding is going to be removed that is making that psychiatric emergency room sustainable, then it didn't make sense for us to continue that psychiatric emergency room.
Right.
Right? Especially because we can, in fact, care for these patients in our other emergency rooms. So if it weren't for the loss of the $4 million of funding, that emergency room would remain open.
Right. You were very clear about that. There was no confusion. You're just being kind. There was no confusion. None whatsoever. Not as far as I could see. For all the meetings that I was in, there's no confusion. And you were being dragged through the mud. You were being blamed. How dare they? We're incensed. I've got the text messages. Incensed that you would go behind our back, throw us under the bus. Total BS. Which leads me to wonder what exactly is going on over there. $7 million to a nonprofit. You were losing money in Cleveland Heights to the tune of what, about $1 million a year?
Couple million.
Did you ever approach anybody at the county or the Adams Board to help you out there with that hole?
So we did not make a formal approach to help with that hole because we really thought that we had some ideas around how to improve efficiencies, had ideas of how we wanted to, update the staffing models. We worked with our staff to update protocols, to improve management of patients before they even got to our behavioral health hospital. So we really felt that the first step we needed to own with the behavioral health hospital and to say what can we be doing better and how can we improve this ourselves in very much the same way we have across the system, to look at other efficiencies.
So you were eating.
So we were eating that couple million per year, yes.
Right.
But again, with the idea that we had plans to move to a more sustainable place.
Right. And I understand there was a movement in leadership at Metro, that didn't work out. But you were very clear. So I just want to let you know that I know, that they now know, and they know that something happened here and it wasn't your fault. But $7 million of federal money through the state of Ohio, through the Adams Board, was quickly run to a nonprofit. Adding your $4 million, $11 million into a building, taking away what you were doing. No discussion on helping you out. No discussion on your hole, but providing a different service in a different place. I smell a rat. I had to rewatch our meeting where you came to and no board members showed up. twice yesterday, just to make sure I was hearing what I was hearing. And I have to retract. I stated when I started, I said, there are no bad guys here. I suspect there are. And after this meeting, I'm going to call who I need to call in the federal government, the state of Ohio, and the prosecutor of the county to take a look at this, because something stinks. And you were being blamed. Probably not to your knowledge. I find that unacceptable. I'll be submitting that amendment. I will hope my colleagues see it my way. It will not affect the bottom line on our budget, on what we're doing right now. It'll come out of a different fund, and I think we can do it. And I apologize to you right now and in public for what you have been dragged through, probably unknowingly, but unnecessarily. I apologize to you. And I'm going to get to the bottom of this. I don't have a lot of time in this position left, but this one I'm going to find out about, because it's really kept me up at night. And when I say kept me up at night, it's kept me up at night. And I don't really allow this job to interfere in my personal life. And this has got me. And I can't figure it out. But I will. Thank you.
Thank you, Mr. Gallagher. Mr. Sweeney?
Thank you, Madam Chairwoman. Madam CEO, how are you?
I'm well, thanks. And you?
Good. I just want to thank you for being the partner that you are. When you came up, you said, I want to do this job, and I'm going to do it well. And you're going to lead this place. So I'm thanking you for that. To the board, under Dr. Harry Walker's leadership, I couldn't be happier with the team, the members of that board that add stability and oversight to your responsibilities. And to the faces of Metro Hospital that are sitting behind you, your executive team, I can't thank you enough for what you do to highlight and provide the services that your CEO has been talking about. They're the ones that make it work for you. So, and I want to thank you for explaining very specifically the journey you had in regards to the Behavioral Health Emergency Center. You hit it exactly how I understood it, and I had a very good seat here. So thank you. The one question, you mentioned the outpatient health, the new health. How does that going to help with the increased access to care? That's one of them. And how does it partner with the neighborhood? Can we talk about that a little bit?
Sure. And I do have to say, I feel tremendously supported in my position. So thank you. I feel supported by council. I am very excited about the outpatient health center. And there are a lot of reasons why. I alluded to it in the presentation, but that we took a structure that was meant to have a significant amount of administrative space, and we kind of turned on the dime when we realized that our community really needed more clinical care in that space. And care has changed as a result of COVID. I know there were a lot of horrible things that happened as a result of COVID, but there's a lot of good that happened too. It pushed medicine to create new and innovative ways of providing care that would have taken us decades to get to. So things that were always done in the inpatient setting are moving rapidly into the outpatient setting, and this health center allows us to provide that cutting-edge care. And if I could even just shine the light on our cancer care center that's going into that building, that's going to be providing just such innovative care, especially around breast cancer and breast health, that we can diagnose and treat at the same time. I mean, these are the sorts of things, you know, the way in which healthcare is exploding with biologic therapy, where we're really understanding the genome much better and being able to create biologics that are specific to diseases. That's what we're going to provide in this health center. And there is no way we could have provided that with how that building was originally intended. So we really listened deeply to the medical staff, to our researchers, put our heads together and figured out what needed to be in that building, and then created the path forward to make that happen. So again, this will be a game changer and will set us up into the future. Right? It will take us 2 to 3 years to really fill out that building. That's what happens when you go into a new space. But this really sets us up to take care of patients for generations to come. So very proud of that building. How will it interact with the community? Prior to the building being fully clinical, we were really looking at taking our care out into the community. And what we found time and again was that patients want to come to main campus. They see 25th Street as their place for healthcare. And so we really needed to listen to that and to create a space that would meet their needs. So that's number one, how we're interacting with the community. But I also mentioned the pharmacy, and I think that we have unfortunately experienced pharmacy deserts really all around the county and our surrounding communities, and to be able to have a pharmacy on main campus that's drive-through, that's open 24/7, that you don't have to be a patient of ours to get your meds there and your therapeutics there, that to me speaks volumes of who we are as an institution. You can get your care somewhere else. If that's what works best for you or your family, or that's what your insurance covers, we want to make sure that you can get your meds when you need them. So if you're seen somewhere else, another emergency room, and you need a prescription, you're going to have to wait often a full day to get it. You can come right after that visit, pick it up, drive through, and home you go. So there are really important ways that we're going to be able to serve our community with this that I'm really exceptionally proud of.
Thank you for that fuller explanation, because I knew about it, didn't know what it all entailed. And through the chair, the one thing I saw right now was your excitement and your team. And you decided, you, the board, your executives, you said, we got a building here. What should we do with it? What do we need? And this is what came out. The thing that's like the game changer is the pharmacy. 24/7, right there. It's their hospital. And through the chair, bringing the care to the neighborhoods. Jasmine and Janice talk about the partnership that you have, if you walk in the neighborhood, you'll be trying, but embracing the leaders of that neighborhood, partnering with them. They already have the history of, that's Metro, that's ours, but they're going to have the feel and the welcoming, and they're just going to come naturally because of the invitation that you've given them through the leaders that are there. I could talk a little bit longer. We're here to help you any way we can. Under our council president, our chairwoman, we're going to do what we need to do to try to take care of you. Thank you, Madam Chairwoman.
Okay, thank you. It looks like we have one more question, and I'm going to ask Ms. Carney if she can get ready so we can move forward. Mr. Jones?
Thank you, Madam Chair. And good morning, Doctor. All right. First, I appreciate the conversations that you and I have had, again, around the closing of the Psyche D and that dynamic. But I think I'll start by saying, to Councilman Gallagher's point, the critical services are something that I pay close attention to. This is after 14 years, this is probably the most serious budget crisis that we have had. So that is literally saying something. But whenever departments have had to have a reduction, many times I would go to them, and sometimes even quietly, and say, I know you have to take a cut, but what are your critical services, and are they still being maintained? So that we know how deep we're cutting and if we're cutting too deep. I take that same approach across the county, in this case, not just a department, but looking at everything. And Metro is, for me, one of the more critical things that we do, if not the most critical. So I say that to preface, when you ask to have the budget restored, I am receptive to that. And the only asterisk I place on it is I want to see the rest of the budget, everything, every presentation, before I put that final nail in the coffin, so to speak. But I am receptive to the need to maintain Metro as the critical institution that you are in this community. So we will stay tuned for that. The other concern is, as my colleagues have asked, about the whole dynamic around the closing of the Psych ED. I appreciate the time and the conversation that we've had that helped me with the timeline and all that was happening. I'm going to put it this way. When it comes to the mental health services, I've looked at it. One, you stepped up when Charity Hospital closed. So you were there and we put monies to that. And I'm glad to know that the full $5 million wasn't simply for the Psych ED. That clarity was helpful. With the behavioral health hospital remains, I don't know what portion of those dollars went to Psych ED, but if that is closing, my feeling now is that we have been playing whack-a-mole with mental health services. The 40 beds are an incredible addition, but an incredible addition at the expense of losing the Psych ED. You know, you lose Charity, but you step up and fill the gap. Again, how does the entire ecosystem come together and say, how do we provide stability and critical services to this community? And I still say the entire infrastructure or ecosystem, whatever the industry, all of those that are part, how do we come together? And offline, not necessarily, you have to do it in front of the cameras, in front of the media, but come together, Adams Board, everyone, and fight it out if you have to, you know. But someone step up, someone step back, and someone partner, and that's your world, not mine, to say how that works. But I encourage every party to step in and say, let's see what we can do to make sure we're delivering these services to everyone. For lack of a better institution, I believe the Adams Board was the one to lead that. The dollars flow through them. So I've said that to them directly, publicly and privately. But I still have an expectation that despite all that has happened, that we still find a way to deliver these services to the community and all partner and see what works. So with that, so that was my comment. And I'll stop there because that's ultimately what I wanted to share, and I won't go into the weeds of everything else at this moment.
If I may respond.
Please.
So we still plan to be a critical piece of providing behavioral health services to the community. We have a growing outpatient presence, and we have our psychologists and licensed social workers, therapists, and so forth, not only centered at our Cleveland Heights office, but at offices throughout the community, and we have them embedded in our primary care offices as well, with the idea of decreasing the stigma associated with getting mental health services. So we have a very robust outpatient offering. We have the opportunity to see psychiatrically ill patients in our other emergency rooms, and by redeploying our staff to those sites, as well as to our outpatient site, we still will care for those patients. So us closing our psychiatric emergency room doesn't close the door on patients getting care. It just redirects them to other points within our institution where they can get that care and still maintain the inpatient unit for those who are the most critically ill. So we still plan to be a very significant contributor to the care of patients with mental health disorders, and really do look forward to working with others to create a continuum of care throughout the community. So we're not closing the doors on providing that care. We're shifting it into the places where we know we can deliver it and can deliver it without requiring a subsidy from the Adams Board to do so. Does that make better sense?
Well, I appreciate it, and I do understand what you're saying, but I simply ask the question, the way the landscape is going to appear in the coming days, weeks, months, where will the Psych ED work that only the Psych ED can provide, where will that be provided?
And that, at least for us within Metro, will be our regular emergency rooms. Remember, at the Cleveland Heights facility, the psychiatric emergency room is immediately adjacent to our regular emergency room. we will still have that space there. We could potentially pivot into that space if we needed to. Again, I don't want to make a promise that I can't deliver because we're doing the hard work of saying what makes sense for the utilization of this space and how do we carry this forward, as opposed to saying we're going to staff this 24 hours a day, 7 days a week with this level of staff. So we're going to do that deep work of how can that space be best utilized because the space is there. We don't want to waste good space. But anyone who has the need that would present to that psychiatric emergency room will go to our regular emergency rooms. If you look at our admissions to our behavioral health hospital, a little over a third come from our emergency room at main campus. Those spaces are being refurbished to create space where a psychiatrically ill patient can be seen. We have such a space already at main campus. Our plan is to update that to make it more patient-focused and patient-centered, but we can also manage in our other emergency rooms as well. So they can come to the regular emergency room and still get that care.
Okay, so instead of just a specialized targeted emergency room,
Exactly.
yours, but then by that same token, does that open up to the rest of the industry, Cleveland Clinic, UH, their emergency rooms could be used as well, I'm sure.
Yes,
With certain
and-
caveats and.
For sure, and they are today, because when a patient is brought in, they're typically brought to the closest place that can provide the care they need. So as it stands today, patients are brought into a wide array of emergency rooms.
Okay, all right, well, I appreciate that, thank you.
Thank you. Thank you so much for the opportunity to present. Appreciate it.
Ms. Simons twisting my arm.
Just very quickly, Madam Chair, just to remind Councilman Jones that the doctor did ask for a time for a comprehensive plan. But that being said, it's not a question. It's just to correct Gallagher. There was a board member who showed up at the meeting. It was John Corlett, and we appreciated him being at a meeting.
No,
But-
our meeting here, when the vote was taken.
Oh, yeah,
there
no
was
board
nobody-
members.
There was nobody
Okay, just to
here.
clarify that.
That would have been the one to be, and I appreciate John
Sorry,
being
Madam
at
Chair.
the Metro Board meeting.
Right.
Okay. All right,
Madam Chair,
ma'am.
I would like the record to reflect that Councilmember Jones and Councilmember Castleberry are in attendance.
Okay. All right, well, Dr. Alexander, thank you for that. We could have been here all day. Appreciate you and all of your staff and members of the board for all that you do for us. Thank you. Okay, Ms. Public Safety Justice Affairs, Director Brandy Carney.
Good afternoon, Council. Brandy Carney, Director of Public Safety and Justice for the county. We're thinning out here. I do have slides for both, to cover both the Public Safety Justice Affairs budget as well as the some opioid fund slides for everyone. They're, within the presentation, they're separated, and then there's a few combined slides also. Let me see, next slide here. So, first slide, just for everyone to see are the makeup of Public Safety Justice Services. The ones that are in green in the presentation are those that the PSJS budget covers. You can see myself and our Deputy Director, Jill Smilak. We do have a Program Officer 4 that works in the administration down there on the left. And we handle largely the opioid fund, all the different opioid fund dollars and the projects that go with those funds. The other 4 agencies at the bottom, which include Fiscal and Grant Services, Witness Victim, Emergency Management, and 911, are agencies who have their own budget, but is obviously part of the entire PSJS budget. We do also have now the Office of Violence Prevention, Maisha Watkins, and I know she's speaking after me today, and she doesn't have a dedicated budget for the year, but we've been able to help her out with some support from the PSJS budget with things like outreach materials to date. And our unit itself has worked on a recent grant application I know she's going to speak about, so we're working together within the department. I do have on there also the REDS board, which is the Criminal Justice Information Sharing. It's in blue. That's just because it used to be under Public Safety Justice Services. And while the operations did move a few years back under the Sheriff's Office, which are projects like the license plate readers and mobile cameras, we still internally manage the dollars, so the budget for that for CJIS. Okay, next slide. So we'll start with just, I have a couple slides from the opioid settlement fund. Just a little history for everybody. The Bellwether litigation occurred and ended in 2019, and we received approximately $124 million at that time. Since then, we've worked strategically internally, but as well as with many community partners. We continue to on projects for mitigation of opioid or addiction, really, in general. There's no general fund or HHS dollars are used on the opioid settlement fund. It's its own fund set up with only the dollars from our Bellwether litigation. Recently, however, with federal litigation that occurred in the past probably 8 or 9 months, for the first time, we've been receiving payments that actually come in fairly randomly, but from the federal litigation that occurred for everyone. And so to date, we're at about $4 million that we've received from those efforts. So the cash balance that I show there, the $76 million approximately cash balance that we have, $72 million is from our Bellwether dollars from our litigation, just as an FYI, and then the $4 million is recent dollars that came in from the federal litigation. There is also the statewide litigation that we were part of, which is called One Ohio. We do expect to receive about $15 million over the course of the next 15 years. It's Cuyahoga County money, but that money never actually comes to us. So soon we'll be in a second round of providing funds for about $1.7 million in projects. We did the same approximately a year ago. We have a board as well as a subcommittee that reads through all those grant applications and identifies projects. Regarding the last thing I'll mention in red there was earlier or mid this summer, we worked on and provided a spending plan for the opioid fund, because I'm often asked how much is left in the fund. And while, as I said, it says 76 million, there's still some projects that we've identified for the future. They might not be, it doesn't make sense to do immediately now, but maybe, second quarter next year and so I think that spending plan is just important, so it doesn't seem like there's $76 million that's unaccounted for and no plan for at this point. So just a little history on the opioid settlement fund. The first two bullet points, the $12 million and the 23.8, we put out an RFP a number of years back, and we're able to fund both capital investments as well as programming investments for local addiction service providers. So addictions, for example, one of those entities, there were 12 total, but one of those entities was Stella Maris. And we've been able to, we provided them over $6 million. So some of the projects they've done more recently is expand their footprint in Tremont. They purchased the rectory building right across their way, and they have some internal residential beds now for people that are on medication-assisted treatment, which is something new for them in that stage of the recovery process. So it's been really great that that's happened. They were able to expand their coffee shop and kind of a communal area that they have, as well as build out a room for meetings and such that they offer to the community. They are in the process of purchasing another building just down the street from them to make, so they have a lot of, right in that area there, which has been successful for them. So they were one. The Y-Haven upgrade of the entire building was really great to see. They had a ribbon cutting approximately a month ago, and that was the $4.5 million that we provided from the opioid fund to upgrade those units throughout the whole building that they have who are individuals. You know what, let me go back just 1 second. Sorry about that. The $32 million, that is collectively, since we started the diversion center programming, that includes any money that we've given to date from Frontline, who runs the hotline, the 24/7, 365 hotline, the crisis intervention training that for any law enforcement officer or public safety throughout the county to identify, to communicate de-escalation practices for when they identify someone with addiction or mental health needs and come into contact with them. So that's the 32 million total that we've used to date in the fund as of the end of last year. The $7.7 million, and I have a slide for Metro later, but that's total. When we first did a separate contract with Metro for addiction services, it was because they were and still are our provider in our jail for jail services. Which was really great, the increase in addiction services. And I have some stats later on that it's really nice to see how much we've been able to enhance those services in our jail with them, but with these dollars. And you guys did just recently approve the third extension of that extension for that agreement. And the community awareness campaign we'll talk about here, it's about $500,000, and that campaign continues to grow, which I'll mention. So just a couple accomplishments. Some of these I talked about briefly just now. The Metro Health programming, one of the things I just wanted to mention again, this is with the dollars that we've provided from the opioid. When we first started this, that was approximately 2021. The ED transports to withdrawal management significantly declined. They did again last year and the last 2 years, so the budget. But I did want to mention, even when we first started, it was approximately 70%. So it was a huge decline at the very beginning. But by providing, Metro's does a great job providing all these services internally. We do have a dedicated pod in the jail now for people going through withdrawal. You can imagine how much more efficient that is with all those individuals that are having a really challenging time. Put them together, nurses can dedicate themselves and their services to those individuals. Counseling services can occur, so to help with their longer-term recovery and services while they're in our care. We do have, because of these opioid dollars, approximately 3,700 patients have been referred for ongoing medication-assisted treatment. So it starts in our jail and for ongoing once they leave. So hopefully they stop that addiction. And the patient navigators that we were able to provide funding for do linkages for individuals with addiction needs. So linkages to, or even, housing is something, or linkages to recovery centers. And so we are at about over 4,500 patients for those services. The most recent contract actually just added another patient navigator for Metro. So next slide. The diversion center, I apologize. The diversion center, I've talked about this before. I will just say since 2021, and again, when you open up a building, if you guys recall, within 6 months, we had this open and operational. We've seen approximately more than 5,100 individuals in crisis have went through there and received services. These are individuals, many of who are homeless, don't receive a bill. We take care of that. We immediately provide the service to them. And one of the stats that I think is important is 75 have co-occurring mental illness and addiction. So I did break it out each one, but that's common in our jail. Obviously, it's common in the diversion center. Those go hand in hand with one another. I already talked about Metro, the contract just recently approved. These are approved to move forward. The communications vendor and Cleveland State, just for clarification, that says 1.5 million. That's not all for Cleveland State. So that project is started off in the last 2 years. We've identified a website drughelp.gov that is specific for Cuyahoga County in need, so for addiction. So it's the first information that's provided like this to anyone. You go online, let's say you need to find a withdrawal center or that's in Cuyahoga, but you also have PTSD, or you're also from LGBTQ community. You can be very specific, and it's going to point you to who might have those services, how many beds they may have. So really helpful to the person in need. It's immediately available at their fingertips to find these resources that we have. So that project has that piece, and it has a media campaign piece, which includes a message that for individuals not ready to quit, we encourage them to use with someone else. Don't use alone. If someone were to overdose and you're alone, there's nobody there who can possibly provide Narcan or make sure to keep that person alive. So, if someone is going to, then that's the next best option that we have that we want to encourage for individuals. That project, and this will be coming to all of you on the fiscal agenda for, I think, next week, is $1.5 million for to encourage some of these messages and to work with local communities to their needs within that community for addiction services. We've recently done the Near East Side. The hope is in the 3 years, or the plan is in the 3 years, to do that countywide. So we'll be doing an RFP for neighborhood-based organizations to work because they know their people, they know their area. Sorry. And again, this is a spending plan. I do have some pending projects. So it looks that would ultimately be some of those that come out of that 76 million that I spoke about previously. That looks like that's cash, but those are just some of the future projects that we have currently planned. This is for Public Safety Justice Services now. This is an actual exercise of the team. We did a recent exercise with the Good Time and the Lady Caroline, a water exercise with search and rescue and multiple public safety organizations, something emergency management does often, but that's just a great picture, I thought. So a couple highlights from 2024 and 25. I have to say this is a really great department. It was hard to pick and choose which ones to put on there. Administrative, which again is the few of us doing project management, I did include the addition of having an Office of Violence Prevention, which is really exciting. She's an amazing administrator, and there's so much opportunity for growth and programming with that unit and with the community and others. Let's see, emergency management, we did receive a state declaration, so that means communities for the tornadoes that occur, there was some reimbursement that they were able to receive, and much of that work on the front end is done through our Office in Emergency Management, working with the state. They've also coordinated for so many different public agencies, public safety agencies, countywide exercises, drills. That's very common for them to do, as the one that I showed recently. And they are maintaining and up for their accreditation again. A couple years ago, when they first received it from the national organization, they were the first county emergency management in the state of Ohio to receive it, and they haven't let it lapse since. So really great group of people. CCOMS, which is our 911 center. We've had a lot of discussions regarding the next gen 911, what that means, what that doesn't mean for individuals. There's some pretty significant large projects coming up in the near future with 911, so working with all of the communities that we have in the county. And then took a leadership role with Amber Alert. So we are on a statewide, it's a regional committee for Amber Alerts for the Northeast Ohio region. But one of our supervisors in CCOMS was actually requested to be on the governor's task force. So she's been sitting on that, but just another noteworthy part of the organization. Witness Victim Services, they have had a significant amount of walk-in clients. Cleveland, particularly the last 2 years, has recommended for clients for services that Witness Victim provides at the Family Justice Center, so the walk-in. So without asking for increased staff, we've been able to maintain our the current clients, but as well as an increased number of walk-ins. They reinstated outreach. I think outreach is very important. Emergency management does a lot of it, so do pretty much all the units. But witness victim was strapped, but we've shuffled some things around, and so we are doing some outreach events to get the word out for those victims so they hear about us. And the high-risk domestic violence, so that project we received a grant a couple years ago. Helps to identify a high-risk situation where it could ultimately end in a fatality for domestic violence. That program, the grant did end, but we were able to absorb that internally. So that grant just ended, but the program doesn't stop. We're working with all the police departments countywide and continue to, so there's a standardized method of responding to those type of high-risk events. And fiscal and grants, this is great. We 93% utilization of grants for the period for 24 and 25. I just did a quick look online, and it said, like a public sector, report said a good goal is 80% utilization. So I just wanted to note how much we take that serious, and that unit does a very great job of managing and the grants for them, as well as some of the other public safety agencies, the medical examiner's office, and external agencies. So just a couple more slides. The executive's 2026 budget, all of our grant funds, $14.5 million. But the 12 million that I'm showing is the chart that's showing right there. The difference includes, just give me a second. It just escaped me, but it'll come back for the difference. I know what it is. So I knew that you guys initially had 14 million, but you guys probably have a different number in your budget books because of the way that you budget the grants for these 2 years versus usually a 3-year cycle. So what you guys would probably see is the total 12.2 million. And as you'll see, the HHS levy is the smallest amount. Wireless is a large amount. That's the state funds that we received. That's a tax on cell phones within the county for any cell phone that's purchased. And recently, this is a statewide legislation increasing the tax on cell phones. Currently, it's at 40 cents. It's going up to 60 cents soon. So we're going to significantly increase the amount of revenue we're bringing in. However, that's revenue that through a board that we have working with communities all over the county that they've asked to receive those funds. So we're working with them. That money is what goes to the 911 system. So all parts of it, the network, the software, the hardware, the 911 system that we use within the county, all of the different dispatch centers in the county use that system. It's a single system that we manage. The last two slides I have, 2 pages. The executive's budget that I have here. Again, this is broken down within each one of the PSJS agencies that we have, just to show, again, CCOM being the largest, but a lot of that is wireless fund as noted in the table there. I did want to, and I'm not sure if you guys have this slide, but it was added just to show personnel, how it's broken down with the personnel versus operational funds. That's usually an important question that was added to the presentation. Those are very hard to see. The highlights for the 26 and 27, and these are just a couple things I'll mention. One is our public safety workforce development program. We started, usually when individuals hear about public safety, they might think fire, EMS, but they don't know about how many different jobs there are in public safety, and there's so many different types. That was one of the reasons, as well as the sometimes lack of diversity seen in public safety. And so we're really working to, especially in high schools or even young adults, make sure that they know about how to get into public safety, even police and fire. A lot of times if it's not a family member, you might not know the process. So we have an event coming up at a large auditorium. We're busing in schools from all over, a lot from East Cleveland, for example, and they're going to be able to talk and hear about all these different public safety agencies and what a day in the life kind of is. So everything from a correction officer to a prosecutor, so different public safety as well as police and fire and the ones everyone seems to know. I won't go through all these just because of time, but I will mention that emergency management, the accreditation process that I already talked about. And then my final slide. It's a great picture. That's Nicole from our from emergency management on the Port of Cleveland, right down the hill from the exercise. But the challenges ahead, I think we all know some of the challenges that we've had, as stated here. The impact of the hiring freeze has been a challenge. We've lost some people and haven't been able to replace it, but I am thankful for the chief of staff and HR and working with us, and have recently approved some allowable adjustments that we can make. We can't hire back those positions, but do some things. The further reductions that we've had in the budget is challenging, but this is, we've been through this before. We work together, and that's one of the benefits sometimes of having these different agencies and working together, because we can help each other out sometimes and supplement some of those gaps that we might have temporarily. And we have a CCOMS dispatcher, and I'm happy to take any questions that you guys might have.
Ms. Conwell, then Mr. Kelly.
All right, through the chair to Brandy, and I just gotta find my pens. I try to write them on the slides. Okay. Okay, so to request, if you could send council the projected projects that are started to be used by the funds, and I'm on the opioid funds, the overview page. And then the projects list of the opioid dollars, the projects that the dollars have actually been used for thus far.
I can absolutely do that. We have both, so when I get back to my office, we'll send those.
Okay, now I'm on the opioid settlement approved spending plan, so just two questions, I do believe.
Yes, ma'am.
So your, the communications vendor to be determined, is the vendor going to be coordinated with 211? So you talked about that was kind of what they're proposed to do, but we have 211 where people reach out. So just wondering if that was a thought in the RFP for them to coordinate with some of the systems that we have already.
Sure. So to the councilwoman, the reason I have the communications vendor is this project, in addition to the website that I talked about, it started as a media campaign. We did work with our communications department, and we went through an RFP process and hired an outside media entity that provided materials. And again, don't use alone, not ready to quit those materials. Those materials are completed and ready to be used, but this project is expected to be with that, if the 1.5 million is approved next week, up to a 3 or 4 year project. And so the reason I included that is at some point, it's likely that those might need to have some small adjustments, whether that be done internally, or if it's something big, maybe there's something that happens. But I can tell you, we, just like we did with these dollars when we first went through it, we reached out to agencies like Adams and others in the space. And so 211 would be one of those entities. We want to make sure we're not duplicating services and that they also understand what we're doing, just because of where they're at in the, speaking to people every day and having those resource knowledge in the county. So yes, it's a roundabout yes.
Okay, so number two, the vendor, so to be clear, the 3-year contract will be 1.5. Once you select the vendor, will the vendor select the neighborhood-based programs, or will that be?
So we've selected the first round that we've done through the last 2 years, included the money for the media campaign, as well as the first neighborhood vendor, which is on the Near East Side, and that's because it's a low-resourced area with a lot of overdose deaths, and so we started there. The next step upon approval would be to RFP for a next neighborhood, so that ultimately we get to countywide, but we're focusing neighborhood by neighborhood. So we will evaluate the proposals internally for that next step for the vendor that we identify.
Okay, so that's where I'm confused a little bit. So we're gonna do the neighborhood-based programs. So what exactly is the use of the the larger vendor?
Sure. So we have the media vendor that's already done their part. So we have the vendor that we used just recently, but that was only specific to the Near East Side and that area that they're very familiar with, that they know intimately. The next step would be build on that to another neighborhood. So we'll hire someone that knows that neighborhood and is specific to that neighborhood.
So the way I guess you listed the 1.5, it's broken up. It's not just one giant
That's
contract.
correct. That's
Okay.
correct.
Okay, thank you, Madam Chair.
Thank you.
Mr. Kelly, and then Mr. Miller.
Thank you, Madam Chair. Hi, Brandy.
Hi.
Under your challenges ahead slide, number 1, where it says general services can be maintained and mission can be fulfilled, but small adjustments must be made. What do you mean by that? Must be made?
Sure, Councilman. Just with some of the reductions in the budget, so some of the additional travel that we've had within our budget, we're still doing travel. It's still a priority, I would say, even for the executive, but there's been some adjustments. Some of the training we might have done 4 last time, we might only put on 3. These are sometimes done not for us, but we put them on for local public safety agencies. So there's been adjustments such as that, but nothing that I see as being something that's going to cause a significant issue within the department. Just small adjustments.
All right, thank you.
Thank you. Mr. Miller? And then Mr. Gallagher.
Madam Chair, Director, following up on Vice President Conwell's questions regarding the communications piece on the Near East Side vendor, what vendor did you use for that?
To the councilman, the vendor that we used was Strategic. I apologize, it's Strategic something, and I'll have to get the name. We didn't have a contract with them. That was unique because that was at the same time that we had our media campaign. So the media campaign contracted directly with that first vendor. That won't be the case as we move forward now. We will contract with the local neighborhood vendor.
So, Madam Chair, Director, in the future on this, are you going to be contracting with consultants, CDCs, churches, block clubs? Could it be any of those?
Yes, Councilman, absolutely.
And when this program is done in 3 or 4 years, and if opiate funding is all used up by then, will this program just go away, or are you going to find a way to keep this program going, and if so, how?
Sure. So to the councilman, really great question. So one of the things we are trying to do in the community is not only train or teach things, but also an opportunity to make sure that knowledge is in the community. So maybe it's not something that we have to continually train on, and something that they're aware of. We're going to continue throughout these 3 years to look for grants and other opportunities to enhance. For example, on the Near East Side, we look to, just by nature of how how it's set up, there's a lot of places, as you guys know, with Narcan now, can get them in CVS's, but that's a neighborhood where we really felt like the local convenient mart or the local store people might go to. Those might be a lot of individuals who could benefit from having one of those, and maybe don't go to a regular CVS that isn't right nearby. And so providing those resources to them now, then they have the knowledge in the neighborhood, for example, but we can also link them up with a project such as the project that Metro has, Metro Hospital, so that some of those resources can continue when they run out. So we're going to try and look at how we can maintain any of them that are necessary, but hopefully even if there was no money and we couldn't, that we've provided a message that has been helpful for the community as we move forward.
And my final question is kind of the same but broader in nature. It's what other programs are we funding with opiate money that are operational rather than capital in nature, and that And what are our plans for how we would sustain these programs if we're able to sustain them when the opiate funding is used up?
Thank you, Councilman. Another great question. This is one-time money, as we know. One of the things I didn't mention, but we've done with the opioid fund is because the keeping the money in the bank internally was a smaller interest earned on the investment. We invested it externally, and to date, that's earned about $10 million, a little over $10 million, that investment. But as far as the longer term, because this is one-time money, and when it's done, it's done. Some of it depends on the project. There's been a couple capital projects, the diversion center, the recent crisis center that we've been planning that everyone is aware of. The one-time funding that I had mentioned to you for those agencies, those 12 agencies that received one-time capital funding, that was one time. They know we're not continuing to fund of them. Some of these other projects, particularly the Crisis Center, for example, it's a conversation we continue to have. It's a challenge. Grants aren't as what they used to be, especially in this space, and continue to decline, as many of us know. So I don't think I have a definitive answer for that. I can say for the opioid projects that we currently have, we've tried very hard to make sure that it just doesn't have a stop date. So an example would be, and again, just thinking about like the addiction services in the jail. Right now, we talked to the sheriff last year and still decided that I would contract with them for 2 more years because the sheriff was in process of doing a contract with the new, which with the jail services provider. But sometime throughout the next year, we want to make sure to combine those into one contract, so they're not 2 separate contracts. So it doesn't speak to the money, but just we're trying to plan, and we try to make sure people know that this isn't a continual fund, it is one-time dollars. So
And to follow up on that, if I may, and what about for the addiction services that we're funding with the various community agencies like Stella Maris and so on? How are those things going to be sustained if they are?
to the councilman, that when we initially put out the RFP, those were specific, majority of capital projects, one-time funding. So it's not operational dollars, and they haven't been since the beginning. So they've been able to do those capital improvements, and there isn't that expectation because they are the capital side. And that was one of the reasons why we did that rather than operational.
Okay, thank you.
Thank you.
Thank you. Mr. Gallagher?
Thank you. Brandy, on the diversion center, what's the number of people that did not go to jail yearly?
That did not go to jail?
The purpose of the diversion center was specifically for that, but I've never seen that number.
To the councilman, I don't have that exact number. There's no way to calculate that number, but I would say, you know, the public safety, just the other day, the police chiefs, but also Frontline mentioned that, you know, before there was a diversion center available, there was like a family that needed to call somebody or somebody was doing something. The only place to call was the law enforcement, right? 911, they come and get them. Now we have a location that they can bring somebody to and receive those services. And so
Again, I understand that. My question is, how many people avoided jail? The sole purpose of the diversion center was for that. And we never hear that number. That should be a blaze in the sky. Look at what we've done. We've saved this money by not sending people to jail. I don't see that.
So Councilman, I would say that the sole purpose, you're correct, when we opened up the diversion center was for law enforcement only, to bring individuals rather than jail. That program, while we absolutely receive those individuals from law enforcement, it's not the biggest source of admissions for the diversion center. And we've adjusted because we adjusted on need, you know.
Understood.
Yeah.
It failed.
I don't know if 5,100, I would say, failed. That's still a lot of people.
Unless you can give me a number, it failed.
I don't know who would have otherwise went. I can get you the number of individuals brought by law enforcement from every day since we opened up. I don't have it, but I'd be happy to provide that to you.
And they had to stay, or they're going to jail. That should be readily available. And I understand early on, we had a little trouble with Cleveland, and that's been corrected, and maybe some other cities too. But that was the sole purpose, a diversion center. And the thing that gets me is, it's not a diversion center. I've been saying that for years now, yet we still call it a diversion center. And then we're going to open this new thing up at Charity, and we're saying, oh, we're going to move diversion over there. Are we?
So I would say the services, we'd never want to be duplicative. What we realized, we opened up the diversion center, and as you know, Councilman, the landscape, the climate in the county changed. It was COVID, massive jail reduction. There were a lot of things that happened at that time.
Right.
So we adjusted based on need, but there's still some things a lot of times that we hear that the diversion center, it's not set up to do. And so the crisis center will provide the services diversion provides, plus additional services. But I will get you that number, sir. I have it.
Understood. But my point is, put a lot of money into it, put a lot of thought into it. We did rush it. We all know we rushed it, and we didn't want to rush it, but our hand was forced, and we did that, and it just didn't do what it was supposed to do. And my hope is that somewhere down the line, a diversion center, a true diversion center, would do that. But this one didn't work. That will not, whatever they do at Charity, will not be a diversion center.
And nor is it intended to be.
Right.
Yeah.
Right. And we don't want to be
And
duplicative in services.
Absolutely not.
Yet we submarine Metro out in Cleveland Heights, but okay. I see on here, you're talking about on the Behavioral Center Crisis Operations, 3 years, 12 million. I assume that's 4 million over 3 years.
That's correct.
And then you say
And it hasn't went to you guys yet. Yeah.
future contract between the centers and Cuyahoga County will be submitted in 2026. That's a 7-year contract, right?
So we had the $7 million approval for the capital side.
Correct.
The next and only other one is the $12 million for 3 years that's coming forward. So that would just be, those are one and the same. So
Okay.
a future contract for that will be
So
coming
that
to
only
the court.
covers the 12 million?
That's correct.
Okay, why aren't we covering the other 7 years? It's a 10-year gig, so why are we only looking at 3 years? The concern I've had, and we all know this, and I'm very vocal about it, is that we're given money for 3 years to make whole an organization to provide services, but we're forgetting the 7 years back-ended. So the first years is going to be 12 million, and the way I calculate it, I'm trying to avoid being on the hook for this. And
Totally
we don't
understand.
have any agreement or understanding, nothing in writing with the Adams Board to provide 10 million a year going forward, other than the first 3 years. So what I would do, and no one listens to me, but if I would get the Adams Board on the hook for the $70 million going forward in that facility before I put a nickel into it. Why aren't we doing that? We're only worried about the first 3 years.
So Councilman, I would say, and I completely understand your concern, very valid. I would say when, this is a center's owns the building, they had purchased the building even prior to this being a project. They were going to
Understood.
move their offices into that building. A fairly last minute, a significant change in the project. Adams went to them because Adams received a grant from the state and asked for some funding. At the time, I had spoke to them too, or we had spoke, and we had said, okay, here's X amount of money that we're able to support with this project. It's not 10 years worth. We were very clear from the beginning. I understand the concern that you're bringing forward, and it's something we discuss, and grants and how we can philanthropic in other ways, but those dollars are not identified. But from the opioid fund, it's one-time funds. That was the money that we had for the project.
That's my concern. And I know it's not your call, but I have to put the question on the record, and that's exactly what I'm doing. We're going to be on the hook. If everything falls apart, we can't, we don't know what Adams is going to do. They don't have the money, whatever they're going to do. I said it before, I'm going to say it again, and I'm going to be right. I hope I'm wrong. We're going to be on the hook for $98 million over the life of this. Adams is not on the record for anything but the first 3 years. And neither really are we.
So again, centers, their project, they're opening the building and managing it. We provided this. The Adams Board did, there might be an MOU between those two. That was my understanding, but that could be wrong. I recently, from those two entities. But, the opioid fund, as I showed, once we have our spending plan, there isn't dollars left, Once you go through all those, there's not funding
Get ready
left.
to adjust your spending plan, by the way. So anyhow, so we're going to be on the hook. We're going to get screwed. I'm telling you. I was right on the jail. I was right on the ERP. This is going to be
But
number
those
three.
those are Cuyahoga only projects, I would say, there's
Okay.
other.
While we have the money,
Mm-hmm.
why don't we do an EOC? We all recall, well, not everybody recalls, but I'll fill everybody in. We had an emergency operations center. We broke ground. I remember the shovel.
Painful.
And then Mr. Budish came on board and switched out the EOC for a dispatch out in Parma, which is a nightmare. And we had to pay off Broadview Heights to fix the property up and give them a road or whatever it was. At that time, it was $19 million. With an EOC, our insurance goes down. We have a place to put our CCOMs at. It really is a magnificent thing. And we're not even talking about it, and I wonder why.
I would love, Councilman, a public safety center and EOC, but this money, I think you could easily argue, and I've had these conversations a lot internally, easily argue a portion of the dollars, but this money to solely fund a public safety building and nothing else, I think would be a stretch, and we don't have those other dollars currently available.
And a discussion for another day.
Yeah.
Well, I would, if I were you, push real hard to get an agreement with the Adams Board to send $70 million up to the charity site, or we're going to be on the hook. Mark my words. We are going to be on the hook, or we're going to be paying that federal loan back, or that federal grant back to the federal government through the state of Ohio, which I still have questions about. But thanks.
Thank you,
I
Councilman.
like working with you regardless.
Councilman Miller, thank you.
Just one comment about the operation of the crisis center, that most of the money is not going to come from the opiate fund. It's not going to come from the Adams Board. This is a medical facility, and we're going to treat people, most of whom have or can get coverage from Medicaid, Medicare, or insurance, and yes, we have to do work on the reimbursement model, because it tends not to be good for mental health services, but that's where it should come from, and there's no reason why the county or anybody else has to be on the hook for $98 million or anything like that. Thank you, Madam Chair.
Thank you.
Thank
Mr.
you.
Hauser,
Thank you, Councilman.
Ms. Simon.
I will try to be quick. Councilman Kelly asked you about number one, challenges ahead. For your number two, hiring freeze, how is the hiring freeze affecting your office, Director?
Thank you for the question, Councilman. We have had some challenges. Our grants team and our fiscal team, we've lost 3 of, I think, 7. CCOMs, we've lost some. So a number of the different units we've lost. We have been lucky enough to the addition of the Office of Violence Prevention has been nice. And as I mentioned before, the Chief of Staff and HR has worked with us just recently to help us out with not having those refilled. So it's we're in a much better place, I would say.
And just my last question, your number 3 challenge, what if this pending grant does not come through for the Office of Violence Prevention? Is there a contingency plan on how to fund this office? Because I would be frank, there's no point to create it if we're not going to fund it adequately.
Thank you, Councilman. So the $2 million grant that the councilman is referring to is Office of Violence Prevention from BJA grant. One of the things is that Administrator Watkins, when she comes up here, her office through Peacemakers, where she was before, was actually awarded this grant. However, they rescinded it. It was a federal grant. They rescinded it. They rewrote it, and then they recently released it. That's what we recently applied for. So she's received this once before. However, I will say that when they revised it recently, it's much more law enforcement centric. And so the sheriff has been great. We've worked with him to be a partner on the project. So I think that there's a good chance, but we're also looking at other opportunities. My grants unit and as well as the administrators always looking for grant opportunities. We've had discussions with multiple. So there's a lot of networking and the first steps that are starting right now. And public safety's been able to take on some cost, but your point is understood.
Okay, thank you, Director.
Thank you. Ms. Simon?
Thank you. Just to follow up with Council President's statement that we should be able to cover the ongoing expense of the behavioral center through Medicaid and Medicare, I think you said. There's no guarantee with that of what's happening right now in the climate. How are you projecting that money to keep coming in to support the behavioral center without the county having to give more money?
Thank you, Councilwoman. Again, the centers, but in conjunction with the Adams Board and the county, but the centers has really tried to look at, we're all understanding Medicaid. It's not, at this point, it's not going up. If anything, it's going down, and especially this population of individuals. But really being specific on how we can operate or how they can operate in such a way where that they can find a financial model that's sustainable. So I think the council president was correct in that, or I know he was, this is a crisis center for our whole community. It has a lot of services. They've been successful at so many places throughout the country. There's going to be some challenges. One is obviously budget down the road, but having these first couple of years to show its success, to show the success that it has for the individuals all over the community, I think will really help the longer term planning.
Who pays for the transports of individuals coming into the crisis center they're going to have to go to Metro Health now because they're not next to an emergency department. Who's going to cover that?
So thank you for the question, Councilwoman. I know that there's been discussions with some of the private ambulance companies, I would say. This morning, I just left a meeting this morning with them and local EMS providers and the commissioner. So that's still being worked through. But I would say when you look at, because following the last time I was in front of council, we looked at the other crisis centers throughout the country. And the ones that we recently talked to, there's actually a low percentage, and I can get the very specifics to you, of individuals that go out because of a medical, because those people making the determination on the front end, the police and fire, make that determination appropriately. That's what they're trained, that's what they do. So they take that individual, if they need to go to a medical facility, they take them to medical.
Okay, I want to stop you right here. I want to put a pin there.
Sure.
So you're saying, first of all, so Medicare, Medicaid's not going to pay for the transports, right?
I don't know what's going to happen for the future, but
right now, they're
currently
not.
correct.
Correct. So when I asked Mr. Eric from the centers about this, he didn't even contemplate the cost. And now you're telling me that other states, their police officers are trained to make a determination on what might be a critical mental health versus a heart attack. And your statement here today is that the City of Cleveland Police Department, most likely the ones who are going to be bringing people in, are going to be able to be trained in a medical level to decide whether somebody's having a heart attack or a psychotic episode. That's your statement?
My statement is that EMS providers and paramedics who have a degree, a medic degree, make a determination on whether a patient, and many other of these crisis centers that are very successful throughout the state that are opening, And in the.
I'm going to put a pin there because you said it's the police, not the paramedics.
Police, EMS, they can all bring people, anyone can be brought to the
Who's going to be
the
bringing the
center.
people to the behavioral center? The police?
People can walk in, people's families, the police can bring them, EMS can bring them, they can all be brought. You can self-refer, anyone can go in, it's an open door policy. So anyone who's having a behavioral health crisis can go in and receive services for the crisis center.
And somehow, somewhere prior to getting there, somebody's going to make a decision about whether they need a medical ED versus a behavioral health center. That's your statement.
Councilwoman, that's correct. It's been successful, or a low amount of people. And I'll also say of those 10%, and I'll get you the exact number right after this, that we received from the others, of those 10%, half of them, so 5%, were ultimately transported back to carry on their care. And the rest remained at the hospital. But many of these crisis centers are not co-located with the hospital. It's not a medical model. It's a behavioral health model. There's a lot of staff that, in addition to the psych doctors, for example, it's people with lived experience that have been there before. They're very successful, which is why you hear many opening up throughout the state.
Well, I hope you're not going to come back to us asking for money for this. I hope not. And that you're standing before us repeatedly, that there's not going to be money asked of council or future funding of the behavioral center, that it's going to be funded through Medicare and Medicaid. Somehow someone's going to pay for transport. There's going to be fundraising. And no one's going to come back to us to pay this grant back because there's no plan in place to fund it for the 7 years after the 3. Is that
What
your
I've said,
position?
Councilwoman, is that when this is not the county didn't start this project. This is a project. We went to the centers. We're working with them. We said we have this amount of dollars for you, which is a $7 million capital that was approved from this body. In the near future, I will be coming to ask for another operational, which is in the presentation I've mentioned multiple times. Outside of that, we've been very clear, the county, that these are one-time funds, that we don't have other funds. I can't speak to what's going to happen in the future, though. I don't know.
Yeah, somebody's coming back, but thank you.
Mr. Gallagher?
Just for clarification, and we know this isn't your problem, but Dr. Alexander privately and publicly testified that the reason why you have an emergency ED is preferably attached to a hospital, which is why the psych ED at Charity, when Charity was functional, was attached literally to the hospital. Ideally, this would be attached to Metro. And I understand that fell apart under the previous administration when all that mess was going on. But to suggest that you're going to have an emergency psych ED up there, it's just not going to work, because Dr. Alexander again testified privately and publicly that 90, and I think I'll get the number wrong, but it was a high 90%. 95, 96, 97% of the people that came in a situation where they were in trauma, they had to get them directly to the hospital, because it was usually not necessarily just the psych episode. It was the medications that they're on, and they had to be triaged, preferably close to the hospital where they could get that person over there. 95% of the people have to be transported that are having a psych emergency. So to suggest that's not going to be a cost is fool's gold. So there's going to be a cost, is what the councilwoman is saying.
The cost is fair if there's a transport. That's absolutely understand.
95%.
But I can say it is a much significantly smaller number, all of these operational crisis centers that have been in operation for years, on the amount of individuals that they have to take off-site for medical care, because whether first responders train them, whether they know the model is a behavioral health care, and it's not a 90% or something.
So it should be easy for you to find who's paying for the transport.
I will absolutely follow up. I will just say some of it is underwritten and can be provided through Medicaid or other services, but not anywhere close to.
And again, we're dealing with moving targets here with with the ACA, which was anything but ACA, is now going back to pre-COVID ACA, which was a nightmare to begin with. So our friends in DC better fix this thing. What we're dealing with, the people are getting cut off were the add-ons during COVID, when they opened the doors, ollie in free. But now we're going back to the pre-COVID days, which were bad enough, bad enough. So to suggest that Medicare, Medicaid is going to pay for this, I think it's,
Small amount, there's definitely,
if
there's
you get that,
costs.
but
There's-
again, I'll rely on Dr. Alexander, who does this for a living. 95% of these people in a psych episode, you're going to be transporting them from where, up there at Charity, whatever that site's called, over to Metro. There's a cost, so you should be able to get that cost.
You know, the diversion center, or excuse me, the crisis center, councilman has psych doctors. It's staffed by medical providers. They'll do labs. They're outsourcing labs, but they'll be able to do labs. They have services even that they can do, but any significant medical is off-site. But again, these are for individuals in having a crisis situation in behavioral health.
Again,
And
I've said too much, but boy, wouldn't that be smart to have it at Metro.
Right. In interest of time, we're gonna go on and move on. Director, I know. We know how to find you.
thank
well,
you so much.
yeah,
Thank you,
Okay.
Councilwoman. Thank you, everybody.
You're
Thank
welcome.
you.
Okay, we're gonna hear from the Office of Violence Prevention.
Good luck with
Administrat-
your other 6, 7, 8.
Yeah. Everybody out there, you see how it's going, so we're gonna try to move this along, or we'll be here till 26. Welcome, Administrator Watkins.
Thank you. Good afternoon, Madam Chair, President, Council President. Thank you, Council President and the committee. I will not be long. Thank you for the opportunity to provide updates on the Office of Violence Prevention. It's 84 days today that I've been the administrator of the office. Transitioning from community to county has been interesting, but I'm glad to be here. I'm excited to work with departments, SEAL Center and community, and figuring out how do we create this comprehensive, coordinated plan under the Office of Violence Prevention. There you go. So as you all know, the office was established in May. I started this role in 2025, August 2025. Prior to that, I was the executive director of a community organization called Cleveland Peacemakers Incorporated, where I did violence prevention work for 6 years there. We are one of 16 county offices in our country. We are a part of a national Office of Violence Prevention network where there's 116 city, county, and state offices across the country working to prevent violence in communities. Our mission, Office of Violence Prevention, will take a public health approach to violence, addressing the root causes such as poverty, trauma, and lack of opportunity, while also investing in community-based solutions that interrupt cycles of violence. The office will bring together municipal leaders, community partners, public health experts, youth advocates, and law enforcement with one purpose: to stop violence before it starts. Our mission is rooted in collaboration, aligning with data, community voices, prevention strategies, so that every resident feels safe, supported, and heard. So I recognize that I did come into this office with financial challenges at the county level. I want to thank Director Brandy and the Department of Public Safety and Justice Services for their support. They also helped me submit the grant that we were talking about earlier, the BJA grant. When I was with Cleveland Peacemakers, we received the grant. It was called the Community Violence Intervention Prevention Grant. It was terminated under this administration. And that grant really focused on building a community comprehensive strategy to violence prevention. With it being reissued, now the focus is on law enforcement and how law enforcement can help address violent crime. However, the Office of Violence Prevention is not it's not a law enforcement office. Our work is different. The goal is the same. So we're partnering with the Sheriff's Department utilizing their relationships on how do we create a coordinated effort with community center and community around how to reduce violence that travels throughout our county from a community center approach and not law enforcement. So shout out to Director Brandy. She put out an email to police chiefs in our county and let them know that we needed resources in the Office of Violence Prevention. I was able to collect over 100 gun locks that I will partner with community members to ensure safe gun handling and storage. The Academy of Medicine here donated 40 storage boxes to ensure safe storage, which is, I know, under County Councilman Michael Hauser. He's really dialing in on safe storage. We also launched a Stop the Violence pledge. If you have not scanned the QR code, please do, but it's empowering people in our county from grade 3 up into the 100 plus to take this violence prevention plan. Very easy pledges, such as I will use my voice to stop violence. I will help people in our community. I'm dedicated to building out the strategy and things like that. There will be a gun safety starts here event, partnering with the Cuyahoga County Department of Health, where we will educate community members, provide gun locks, safe storages, and help them understand the data locally and nationally as it relates to gun violence. And then partnering with community organizations like the Institute of Hope that focuses on the social determinants of health in our county, because violence is oftentimes tied to instability in those areas that I mentioned earlier, those root causes, and being able to train community members on how violence prevention is connected to the social drivers of health. Some milestones since August, we had a National Day of Remembrance for Murder Victims where we partnered with a community organization called New Era Cleveland. We also hosted a countywide moment of silence at 128. At that moment, there was 128 lives lost to gun violence in our county at that time. In September, we partnered with Legacies Empowered for an event called Breathe Through It. It was for suicide awareness. In October, we had a Domestic Violence Awareness Month event where I partnered with County Councilwoman Conwell and the Women's Health Commission. November, we are focusing on our countywide violence prevention tour, which I will share more about. We also had a first meeting regarding our survivor-led outreach team, which we will have survivor-led organizations reaching out to individuals who have lost their lives to homicide in our community and their families. We're having a Gun Safety Starts Here event with the Cuyahoga County Department of Health. And then we have a great partnership being established with the NBA and the Cleveland Cavaliers for a social justice coalition. And those are some milestones that we have reached. So some next steps, we're looking for grant opportunities. As you all are aware that the budget, I came into this office without a budget, but with a lot of support from community, from the Office of Public Safety and Justice Services. We want to engage foundations and corporate partners. One of the things that County Exec Chris mentioned when announcing this office is that we do not want to compete with community. So we don't want to take money from community serving organizations, but we want to partner with them, maybe convene and re-grant dollars in a more coordinated effort. I want to work closely with all mayors and managers, again, going back to our countywide violence prevention tour, working with different mayors and managers across Cuyahoga County, asking what are their violence prevention strategies, what do they see as violence in their community. And then we want to utilize information from the Listen and Learn tour to develop what does our plan look like for 2026. So I do want to share that the national breakdown of a budget for Office of Violence Prevention is that of all the money you bring in, 70% of those dollars go back into community. Again, Office of Violence Prevention centers the people who are the most proximate to the work and just doing it in a more coordinated effort. I know that I'm mentioning a lot about gun violence. We're talking about data. This is not an Office of Gun Violence Prevention. But as of right now, the #1 cause of premature death in our country for kids is gun violence. And I'm not sure what the data says as it relates to Cuyahoga County. I'm working on that to see what is the cause of death as it relates to violence in our county, and looking at those priorities to figure out which will be the priority points for this office. When I took this position, I was really passionate about creating a opportunity to listen to people throughout the entire county. A lot of my work have been centered in the city of Cleveland, and so put together this countywide violence prevention tour. We kind of switched it up where I was going to select a few cities to partner with as it relates to gathering data, but we had a great idea to partner with the county council members and doing a district-wide tour where we can partner with you all, ask you to co-host a listen and learn session in your district, invite mayors and managers and community members that are selected to be able to talk about what does violence look like. I know that violence in one city is not the same as in another city, and I want to be able to listen to that and take into account so that we can utilize our county departments, our community partners to be able to address the things that we hear in these listen and learn sessions. I know the office will not be able to prioritize everything, but collaboratively, we can utilize the organizations that already exist to be able to address the other violences that are causing harm to our county. And so I want to get that started as soon as possible, maybe January, where I can meet with you all with the help of Molly to get that scheduled so that if you would like to partner with the Office of Violence Prevention, I would love to have you. And thank you again for the opportunity to present, and I will answer any questions.
Mr. Kelly?
Thank you. Thank you, Madam Chair. So in my previous life, when I was a police officer, I brought you ever heard of the Eddie Eagle program? It's a program for younger kids that works off of a workbook, comic book type thing. And it teaches kids to stop, don't touch, leave the area, and tell an adult should they find a gun. So when you see these stories in the paper about how somebody young finds a gun, either shoots themselves or somebody else, they've had no reason at this point to understand the danger with that. That's a free program. And I took it one step further, and I did a home firearm safety class after that in case for the public, so that if a kid did find a gun, they could tell an adult, the adult would know what to do with the gun because I had them in the class and showed them how to make a gun safe. So, but I would definitely look into the Eddie Eagle program, and it's somewhere you can start at a lower level, and hopefully kids won't touch something that they shouldn't.
I appreciate that resource.
Okay, I think that was pretty comprehensive. We are excited to have you doing this work. I know I personally would like to partner with you, so I'll be in touch. Is there anything further for Ms. Watkins?
Madam Chair.
President Miller?
Just want to add that I believe that this is a very important part of public action, that law enforcement can help by providing some deterrence and by getting some dangerous people off the streets. But there is a myriad of other ways and a myriad of other causes of people's behaviors, and we can head some stuff off with some good action, and so I look forward to working with you as well.
Thank you.
All right, well, thank you. I want to publicly thank Director Kearney for her leadership, as well as Councilman Hauser for his advocacy to make sure that this office came to fruition. For Ms. Watkins? Ms. Watkins, we have one more question from Mr. Jones.
Again, yes, thank you for your service so far. I look forward to working with you as well. I also see that we have the coroner's medical examiner here as well. Is there any efforts to work more closely with the clarion call of numbers that we get from the medical examiner?
Absolutely. I had a scheduled meeting, and we're going to meet again as well. But a big part of people understanding what works and what doesn't work in our county or in our city is being very transparent with data and being able to let people know what we're doing as it relates to those numbers. And not to say it like that because every number represents a life lost to a family, to a community, but being able to share data in a way that's transparent and also very sensible. And so with the medical examiner, working with the survivors to be able to have families contacted for grief support. And I think one of the things that I know to be true is that oftentimes families get calls from either a homicide detective or a trauma department, but what would it look like to have a community voice where we center people who have already been impacted by the disease of gun violence to say, how can I support? We have these grief sessions coming up. Are there any surviving siblings that can benefit from these community organizations? But really working closely, hopefully with the medical examiner and others around data and a public health approach to be able to help get data out in a way that we all agree on, because I do know data is hard to share in our spaces, but being able to trust that we'll do the right thing with the data to inform the community around the progress in the process.
Thank you.
Okay. All right. Thank you, Ms. Watkins. All right, we'll now hear from the Honorable Clerk of Courts, Nayla Bird.
Good afternoon. That was Brandy taking something. Good afternoon, Chair Turner, to Council President Miller and the other members of Council. As you well know, my name is Nayla Bird, and I have the honor and privilege of serving as Cuyahoga County Clerk of Courts. The mission of the Cuyahoga County Clerk of Courts Office is to perform all statutory duties relative to the filing, preservation, retrieval, and public dissemination of applicable court documents and records pertaining to the Court of Common Pleas, General and Domestic Relations Division, and the 8th District Court of Appeals. The Office of the Clerk also holds, collects, and disperses fees and costs paid to the court in a secure, timely, and cost-effective manner. In sum, our office is a critical partner to ensure the integrity, accuracy, and transparency of the operations of the judicial system. To accomplish our mission, we work extremely collaboratively and cooperatively with all of the judges and court administration. We also maintain, seek, and encourage inextricably professional relationships with all judicial system stakeholders and partners. Within our organizational structure, there are 4 departments: the Civil Department, the Criminal Department, the Finance Department, and our old courthouse operations. Like our previous budget, the 2026-2027 biennial budget is straightforward. For 2026, the budget includes approximately $10 million, and for 2027, the budget is approximately $10.2 million. Personnel accounts for approximately 78% of the budget, or $7.8 million in 2026 and $8 million in 2027. The remainder of the budget is mostly other operating costs, which consist of predominantly postage, but also includes supplies, travel, and conferences. This amounts to approximately 12% of our budget, $1.2 million for 2026 and 2027. The remaining 10% of the budget, or approximately $1 million of expenditures, includes costs associated with chargebacks for space maintenance, contracted services, printing, and security. Specifically, in response to Chair Turner's 2025, August 25th, 2025 memo, the Clerk's Office has not had any significant budget reductions or elimination of existing programs, initiatives, or services. There are no budgeted initiatives or increased expenditures in this current budget. And lastly, we have no additional funding requests we'd like this council to consider. We believe we must and we do provide exemplary customer service by responding to inquiries and record requests in a timely, efficient, and professional manner. We also provide access to criminal justice-related services also in an accurate and timely manner. And most importantly, I would be remiss if I didn't end without first thanking and appreciating the dedication of our most valued asset, which are our employees. It is the employees of the clerk's office who provide these necessary services to our colleagues within the county and our community members. This concludes my formal presentation. Mike Smotek, who most of you know, has joined me again this year, thankfully, and we're both available to answer any questions that this council may have. So it seems like there, no, seems like there are none, so thanks so much,
All
and
right.
I'll see you in 2 years. No.
Thank you, Madam Clerk. Okay. Yeah, we're good. We'll see you in 2. No.
Okay.
Yeah, thank you.
Okay,
we're
thank
good.
you.
Yes.
Thank you.
You did a great job.
May I take a moment of privilege and approach Councilman Simon for one quick second?
Yes, ma'am.
Okay, I feel like, can I approach the bench, you know?
Yeah, right. I do have the gavel, so.
That's a good one.
Right. Okay, we will now hear from the Office of the Medical Examiner, Dr. Thomas Gilson.
I'll show a picture. Okay.
Good afternoon. My name's Thomas Gilson. I'm the medical examiner and the crime laboratory director. I don't know if we're showing pictures or we're just going through papers. The first picture.
Papers at the moment.
Papers only. Excellent. I just want to hit some highlights on these. I would mention for the metrics, the key performance measures, our autopsy numbers have been artificially low for the 2 years that are there because of issues with staffing. I expect them to rise. The projected targets of 1,000 are probably going to be lower, but we should be able to accommodate the rise. With regard to funding, we are primarily funded by the general fund. The projected budget of $20,328,392 for 2026 and $20,886,262 for 2027 largely represents increases related to salaries. I want to point out specifically that the Special Revenue Fund is also called the Coroner's Lab Fund. This is a statutory fund that was created for restricted access to the coroner's office when we cover autopsies for other counties. This is dedicated to the purchase of equipment and other necessary items for the agency. This isn't Tom Gilson's slush fund. This money is going to be dedicated over the next 2 years to upgrading our case management, our information database in the office, as well as the purchase of a CT scanner to augment our X-ray capability. 76% of our budget currently pays for salaries. On page 2, this is largely a self-congratulatory page, but the office does do a lot of good work, and I would appreciate acknowledging the folks who work there. I think the most important thing is probably the first bullet under major accomplishments. The office and the laboratory continue to maintain full accreditation. This has a tremendous benefit to Cuyahoga County, and what it means is that the data that's produced by this office is of very high quality. We have multiple board certifications, multiple accreditations of the office, and we are the most accredited public sector agency that I know of in the United States. The office is a national leader, and that also benefits the county because we're able to offer not only quality information, but to offer quality solutions and engage with the national partners to try to bring the best service to our county. I don't want to go through all of this. I don't feel necessary. I think we've worked with enough of you to know that you appreciate what our work does, and I appreciate your support. One thing I did want to point out, just as an example, is the last bullet item, the violent death reporting system in Ohio. We contribute to that. Part of that upgrade of the IT system will enable us to do things more efficiently. And I think the other thing that we've committed to do there is to maintain the value of information that flows out of our office, specifically with regard to violent deaths. As you may be aware, the violent death reporting system in the current administration have decided to not track transgender homicide and suicide. We will continue to do that in the hope that we can at least serve these communities in our county and hopefully collaborate with other medical examiners to provide that information nationwide. Just to run through some of the graphs, because I like graphs. Homicides are expected to continue downward in 2025, though not as dramatically as they did from 23 to 24, but we anticipate approximately 5% decline. The next item are suicide comparisons. Distressingly, these are rising, and one of the things that we undertook here is because the majority of suicides committed in Cuyahoga County are committed with a firearm. We recently did a lot of research on firearm suicides, specifically with the idea of trying to target interventions. Most of the guns that are used to commit suicide are owned by the individual, and most of them, 2%, have some overlap with crime guns. So I think that this is the kind of valuable stuff the office can do, because it points out that the interventions that we do for reducing homicide gun violence are not specifically going to reduce suicide gun violence. And if we don't look at those kind of questions, I think we can spin our wheels in directions that aren't beneficial. Next is motor vehicle crashes. I think people kind of went crazy in the pandemic, so 2021 is particularly high of concern. We really haven't gotten back to our 2019 baseline. Not sure why. It's certainly worthy of consideration. The next graph is busy, but what I would say is if you follow the orange line at the bottom of that graph for gunshot wound suicides, you see what I'm saying. They're on the rise, and that's notable nationally and in our community, that we're tending to see more people of color taking their own lives and more often associated with firearms. I can't show a graph without showing drug overdose data. I would focus on 2025. What I would say about it is drug overdoses are going to decline in 2025. It may look like they're staying flat, but that number, 399 cocaine overdoses, is going to bend downward because it's based on data that concerns screens and not specifically cases that are ruled. We should see a drop, maybe not as dramatic as 2023 to 2024, but we should see a drop, I would say, of about 15% or so of overdoses in 2025. What concerns me about this is that as we see the demographic changing, see more cocaine than opiates, this is going to have impacts on people who are dying demographically. We're going to see more African Americans. We're also going to see more urban individuals, and we're going to see older individuals. And I have been trying to reach out to as many people, and Nail Council included, to specifically say that we are going to enter a phase, if this data persists, which I think it will, where we're going to see a different drug overdose problem in Cuyahoga County. It doesn't mean the opioid crisis is over and the interventions that we have put forth are ineffective anymore, but we're going to start to see stimulants, specifically cocaine and to a lesser extent methamphetamine, account for more and more overdose deaths. And we should be thinking now, how do we pivot to respond to that? And the last one's nice, but we don't have to talk about that. Happy to answer any questions.
Ms. Simon?
Thank you. To Dr. Gilson, why, and I think we've talked about this before, the nationwide shift from opiates over to cocaine and amphetamines?
Supply is down, so that's a big factor, and that may be partly due to less production, tighter border security. And I think the other piece of the issue is that the demand is down, so we don't see as many young people. All age groups have dropped in the number of opioid overdoses, but the most significant drops are in that 20 to 45-year-old age group. So I think at the end of the crack epidemic, we noticed that the individuals who were overdosing tended to be older. I think all those years that we devoted resources to education are bearing fruit in that we're seeing fewer younger people, becoming addicted to opioids. I also can't downplay the role of harm reduction, but I don't think that's the whole story, but it's certainly another piece of it.
So for council to address this shift, what do you foresee that's needed to help prevent this from escalating like it did, what was it, during the crack epidemic?
Crack epidemic,
Do you
yeah.
do we need different forms of education, what do you foresee us needing to help with this?
I think, a couple things we really need to appreciate are going to be different messaging. Unlike opioids, we don't have an naloxone, an antidote. We also don't have medication-assisted therapy that's, I'm aware of at least, for opioids like we had methadone or buprenorphine or those drugs. So it's going to be much more, I think, intensively behavioral directed. I also think that the ideas that we did learn from the opioid crisis, like don't use alone, call 911 if somebody's getting in trouble, and learn how to recognize what a stimulant overdose looks like, a cocaine overdose versus an opioid overdose. These aren't folks who are going to sleep. They're either having, chest pain, heart manifestations, or they're having seizures or things like that, or becoming acutely unresponsive. That's a different problem, and that's not really something that's very amenable to another, person using drugs with somebody to rectify. You need emergency medical services at that point.
Thank you.
Okay, Mr. Miller, Mr. Jones.
So, if you look on the chart, take any of the years like 2021, and if you add the heroin, the fentanyl, and the cocaine, it comes to more than the total. Can you explain why that is?
Mixtures. I mean, probably about a 2-to-1 ratio for most of these years, where we have mixtures of drugs causing fatalities as opposed to just one drug. That's still true with cocaine and fentanyl, but fentanyl, because it's going away, is dropping off. And cocaine, that's why I say cocaine's going to bend down as well.
Okay, thank you.
Mr. Jones.
Thank you, Madam Chair. Dr. Gilson, good to see you.
Always nice to see you.
All right. And just thank you for the work you do. I have a great appreciation for all you do and the information as a keeper of this information. I see a small sliver just from my perspective as a funeral director. I think of times like back in January of 2020, COVID, I saw pneumonia on a few death certificates. And I said, wow, pneumonia, I haven't seen people dying from pneumonia. But then it transitioned, it seemed like maybe it wasn't pneumonia, it was the start of COVID. And it just, my own, I guess, narrative that, I was seeing something happening. And I say that to say I see a small sliver, but you see all of the records, you see all of the information, you're the keeper of that information. And it needs to be elevated from almost encyclopedia-like to, I used the word clarion call earlier, to where when the information comes out, whether it's homicide deaths, what's the number for the year, that it's seen as a, what do you call it, almost like a health checkup. You're seeing what's happening, now respond to it. If violence protection is having an impact, then the number may come down. I believe you have the capacity to share the information in such a way that it's in the public conscience as how the numbers are rising and are what we're doing, are the things that we're doing effective. That makes sense, or am I sound like I'm right?
It absolutely does, and what I'd like to share is we're one of the first medical examiner's office to have dedicated public health analysts within the office. And one of the things I say to both of them every so often is if you're studying a problem with no intention to solve it, you're wasting your time. That's what this office should be doing, and I hope that's how we're perceived in the community, is this information isn't to generate, academic papers or, trivia talk or something. It's supposed to solve problems. And this is a population who paid with their life to teach us a lesson. And I can't agree with you more that I think the mission of this office, and it's one of the things I'm really trying to encourage those two to do, is to get people to do things right. Because when I said that, accurate information informs better policy, we sign about 15% of all the death certificates in Cuyahoga County from my office, and they're high-quality death certificates. How much training do you think the physicians who write the other 85% of the death certificates in Cuyahoga County receive on writing a competent death certificate? Zero. So we get lousy information, nonsense in, nonsense out. I'd like to fix that. I'm going to try to reach out again to the educational institution, Case Western with the Cleveland Clinic, to take time to educate those medical students how to write a death certificate. And I think the pushback that you see sometimes from that is, well, geez, I'm here to learn how to take care of patients. Well, I'm sorry, if you're the greatest doctor ever, all your patients are still going to die. And if you don't know how to write a good death certificate, you're cheating the public out of valuable public health information.
Appreciate that. All right, thank you.
Okay, Dr. Gilson, thank you. Okay, we now hear from the Department of Development, Director Paul Hurtig. We're getting there, we're getting closer. Thanks, everyone, for your patience.
Good afternoon, members of council. I have been watching along and appreciate the length of time you've been attending to various departments. I'm here for as long as you need me, but I will try not to overtax your attention. I've prepared a very short presentation. I think you have that in front of you. Just to give the highlights of what our department is, we are a relatively small department. We have 3 management staff, myself, Vaughn Johnson, our deputy. We have 1 administrative assistant supporting us, 5 frontline staff who are out in the community working with all of our municipalities and with businesses for economic development activity. We have 2 staff who work full-time managing our economic development loan portfolio, and we have currently 7 business services staff led by Laura Sims, who is here, who support not only the Department of Development, but also the Department of Housing. They do double duty there. Our staffing budget is $1.6 million per year from the general fund. Our operating cost budget is $1.3 million a year, also from general fund. And in addition, in the current budget cycle or the upcoming budget cycle, the budget provides for $2.5 million each year of casino tax revenue to be transferred into the Economic Development Fund, which supports our loans and occasionally incentive grants. The 2 main programs we operate that involve spending money are our Economic Development Lending Program and our Office of Small Business. So on the next page, you can see just a few highlights of the economic development lending we do directly. We go up to $2 million, and potentially now, with the advent of the Transit-Oriented Development Loan Program, we might consider loans of up to $2.5 million. We have some underwriting guidelines you see here. Every loan we bring forward is reviewed by a loan committee, which is a mixture of outside private sector experts as well as senior county staff, and then approved either by the Board of Control or by council. Over the past 4 years to date, there have been 28 economic development loans approved either by the Board of Control or council, totaling just under $39 million, and those loans have resulted in just under 2,000 new jobs being created here in Cuyahoga County. The second program that involves spending some county money is the county's Office of Small Business, and this office works with outside partners who receive $1.5 million per year in support from Cuyahoga County, mainly to provide technical advice and assistance to small businesses. They also use some of the money we provide for lending to the small businesses. Many of you have been briefed by Deputy Vaughn Johnson on this program. In a nutshell, we act as a concierge between small business owners who may have no idea what help is available and the many different nonprofits that are out there trying to help small businesses. Our staff listens for 30 minutes or longer if needed. listens to what their problems are, and makes warm introductions to one or more nonprofit agencies that are best suited to help the small business. This has been quite a popular program and successful as well. Counting the final round of stimulus grants at the end of the COVID funding period, over 3,000 small businesses have been assisted, over 3,500 hours of technical assistance provided to the businesses, and over $13 million in funding, mainly for loans, has been provided to the small businesses. That is how we use the money. We are grateful that the county is able to make this money available. Our budget for the next years is adequate to support our continued work, and I'm happy to answer any questions council members may have.
Ms. Conwell?
Thank you, Madam Chair. To the Director, Paul Herdick. I only have one. How or does your department give oversight of the businesses and/or agencies that receive the loans?
Thank you, Councilwoman. For the direct loans we make, we have 2 full-time staff, an economic development loan manager and an assistant, who spend their full time monitoring these loans, making sure that we receive all the required financial reports and, of course, the payments. And we have a written policy that they follow in any case where a loan becomes late on a payment or doesn't comply with one of the other conditions.
Thank you.
Mr. Jones?
Thank you. Good to see you, Paul. Do you also report when someone does not get a loan? Like maybe, I mean, to this body is, I guess, in particular, awarded, but those that maybe don't make it?
Thank you, Councilman. Actually, there is a provision in the legislation for a sunset. So every loan that's approved by this body has a sunset period. And in the rare case that a loan does not close within that sunset period, it is my duty to report that to the Clerk of Council. Occasionally, there'll be just reason to request council extend that sunset. That's been done a couple of times. But in the rare case that the loan never does close, we do make the report. It's taken off the books.
The books, okay. Thank you. Thank you.
All right. Thank you, Director Herdick.
Thank you, Council.
We'll now hear from Housing Community Development, Director Scott.
Madam Chair,
Oh,
he just
what-
ran, Madam Chair, Ben Schaefer, he just ran back to his office to grab his laptop. So 1 second, pardon me.
We'll move on, and we'll hear from County Planning Commission, Director Serby.
Good afternoon, everyone. My name is Mary Serby. I'm the Executive Director of the Cuyahoga County Planning Commission, and I have with me today Jennifer Carafa, our Manager of Business Services. She may be able to answer questions that I may be unable to answer. So we have a little slideshow for you today. I want to thank you, Madam Chair, President Council, to my board members, Councilman Conwell and Councilman Simon. I wanted to just give you a brief update, as I know some of you are new to council, on where we are and who we are as an agency. Oh, sorry, that's me. So just a brief, our vision, our mission, and our core values. This really dates back to 2021 and 2022 when I joined the team in 2021, wanted to meet as a team and figure out where we've been. We've got a long history as an agency, but to figure out if we are still addressing the main issues that we needed to be doing in our communities. I also want to make sure that I give kudos to my team. We are a smallish but mighty, 20 full-time employees, 1 full-time intern, and then one unfunded vacancy that we still carry. We have several members of our team that have certifications in professional, and so that is requiring them to continue education credits as we do our work in the communities. We also provide best practices to our communities, planning, GIS mapping, and other technical services. So before we jump into the 2026-2027 biennial budget, I just wanted to go quickly through where we were for the 2024 and 2025 biennial budget. In 2024-2025 biennial budget, our budget was based on pay 12, which didn't account for a full-time intern in pay 13 and a full-time Cleveland Foundation Fellow in pay 18. So in Q4 2024, a $150,000 budget adjustment was approved for personnel services due to that early baseline snapshot and a projected budget shortfall. When we look at 2020, I'm sorry, I didn't switch it. When we look at 2025, that did obviously not account for the $150,000 that was authorized in Q4 2024. So we anticipated and identified that shortfall early in Q1 2025. So when you look at both of them together, we've had great relationship with OBM, fiscal office, and identifying any projections where we might be looking at shortfalls. And I would just commend Jennifer on her forensic accounting, I call it many times, because we do have a small budget, but we are working very hard to make sure we're spending it responsibly. And I think the challenge that we get with these biennial budgets is that we're based on, they're not based on actual budgets, so then we end up kind of repeating the same issue where we may have had a shortfall based on a different snapshot. So some of the things we did do as a team, we looked at ways to reduce spending given the deficit that the county was facing this year. We maintained a flat personnel count. We required employees to have cost sharing for professional development events, and that was something that we typically had not done in the past, and it was the only way we were going to be able to get people to the state conference this year in order to get their continuing ed credits that they needed. We have once again deferred our website updating since we rebranded in 2022 because the budget just has not been there. We've continued to negotiate lower software pricing, and we were able to move unspent grant dollars to the general fund working with OBM and fiscal office. So in terms of where we are with the 2025 budget update, again, when we looking at early projections, we're doing a very key work in the communities and act as an extension of the community staff. And so a lot of what we do is in kind, and then other work that we do is a very reduced cost. But we typically bring in estimated annual about $200,000 that gets deposited to the general fund. So in early 2025, we identified some shortfalls that we could identify early, and we were authorized to repurpose $37,000 of our revenues that were brought in Q1 2025 to offset some of those budget shortfalls that we identified. And then we are also working, obviously, with OBM and fiscal to transfer those special revenue grant dollars into the general fund. So we worked with OBM and identified, and there is a typo, and I'm sorry, on slide 8 in the green box there, it said Q3 on your slides. It is Q4. That we did a budget adjustment request for $252,000 to offset those anticipated shortfalls. And based on the projections from Q3 2025, that it was increased to $260,000. So that has already come to council as a fiscal agenda and is working its way through the process. So when we look at 2026, 2027 biennial budget, we do continue to work with OBM on this. And for the non-executive agencies, it was based on pay 13 instead of pay 19. Pay 13 did not capture the conservative merits that were awarded to our team. We do have a compensation policy as a non-executive agency. We were very conservative with those, knowing the deficit, but the snapshot at pay 13 did not include those. And I know it's been said before, but our people are our number one priority, and 76% of my budget approximately is for personnel. And so it's everything else we do is they're the most important ones. I have to make sure I'm taking care of them. I do know that several of my team members have been approached by recruiters and other agencies around here because they are amazing and best in their class. So I know the competition is real, and we get to the challenge of not being able to make sure we can give them proper increases. I want to make sure I'm taking care of my people, so doing everything we can creatively too that does not include financial. So we've continued to and will continue to reduce costs where possible, going into this next biennial budget. We know that, we are delivering product at a very low cost compared to a private consultant, and we want to continue to do that and really reach those that cannot do this work alone. All the deposits, all the revenues that we do bring in go back to the general fund, so while they don't benefit our agency directly, they are really including the investment in Cuyahoga County. So I just want to thank you for allowing me time to present that information to you, and I'm happy to answer any questions for you.
Thank you. Any questions? Mr. Jones?
Sure. And then good afternoon again, Director.
Afternoon.
All right. You know, I guess I'll start by going back 14 years ago, one of your predecessors, Paul Alcinas. When I came in, being a business owner, I wanted to help small business, and I told Paul, I said, I want to be chair of economic development because I want to be able to help small business. He said, Jones, that's not where you want to be. You want to be chair of public works. That's where economic development happens. I said, oh. So I'm new, and I said, that's great. So I did, and all of the older councilmen that were there, and they weren't really fighting for the job, so they let the little kid have it, you know. So I've always appreciated the role that you play, your core values of inclusion and collaboration, and just the health of this community through planning. My question to you is, in the efforts, the work that you're doing now, have you found, in light of what's happening at the federal level and the pressure to end everything that's equitable, is there anything that you're doing now that you think is in jeopardy that we should be aware of, and that potential changes to the way you do business?
Yeah, thank you for that question. The good news is we don't have any federal funds currently. We were successful in winning a Safe Streets and Roads for All $600,000 grant that, due to delays in the contracting and changes to the contract language, we deferred our decision until Q1 2026. Kind of given the situation on some of the priorities and where we really were supposed to be doing a plan for all of Cuyahoga County and all the communities, working with them on plans they may have already had, where the focus was really on making it safer for bike and pedestrian and multimodal access. We're still unsure if that's going to be something we're going to be able to push forward. So those were dollars that were returned to the general fund this year. You know, our communities are struggling. I think every day they're wearing 12 hats and they're going to be wearing 20, trying to make sure the needs of their residents are really taken care of. So a lot of what we're trying to do is the proactive work when it comes to zoning, so that if they do want to see new development in their communities, we can help them set the framework proactively to really get the areas that they want rezoned, whether it be for transit-oriented development, single-family infill. We're trying to do that work for them proactively so that they are ready when a developer comes along and wants to invest in their community.
That's great. Okay, thank you.
Mr. Miller?
Madam Chair, Director, thank you for all the excellent work you do in helping moving Cuyahoga County forward. The second last slide says, anticipating budget shortfalls in 2026 and 2027, mainly in personnel services. Is the budget that's proposed short of how much you need, and if so, how much additional is needed?
Thank you for your question. You know, this is one of those things that we typically don't see the shortfall until third, fourth quarter, so it's not something we're going to have on day one, and we continue to work on trying to reduce those spending costs. But it's similar to what I mentioned, where we're not being budgeted based on the actuals of 24 or 25. It goes back to the original budget. So we estimate approximately $180,000 that we may be short, and that would be primarily in personnel services. We're not planning on reducing any, personnel staff that we have, and continue to carry that unfunded vacancy.
Is that 180,000 per year?
Yes, that's correct.
Okay, thank you.
One final comment.
Mr. Jones?
I'll share with you what I've shared with everyone in regards to the last question I asked. I don't care whether it's big legislative changes or even small internal policies, but if any of those federal efforts cause you to make a change to anything that you've done, I always say catalog it, centralize it, and then sunset it for January 20th, 2029. I'm just telling everyone that's
Thank you.
the line.
Thank you.
Okay, all right. Thank you, Director.
Thank you, everyone.
Okay, as Mr. Scott approaches, we're going to have Ms. Simon yield some time to you.
Thank you so much, Madam Chair. Just one quick minute. You all saw Clerk Bird hand me something at sidebar, and I wanted to be able to just show the picture of what, as a moment of cuteness and happiness. These are two kittens she adopted from the Humane Society I work with. So anyways, there you go. That's what we did.
Thank you for that
That's it.
joy on a snowy Cleveland day. All right, Department of Housing and Community Development, Director Scott.
Good afternoon, esteemed County Council membership. Madam Chair, I do apologize. I went upstairs to get my laptop because my contacts are crap right now. So I wanted to make sure I could actually read what was in front of me. I'd be remiss if I didn't take a moment publicly to acknowledge that today is the 250th birthday of my beloved Marine Corps. So to any of Marines in the audience or on record, you know, hoorah, devil dogs. As well as tomorrow is Veterans Day. So to any who have served or have supported one who has served, thank you for your service as well. Department of Housing and Community Development. I had a slide presentation somewhere. There we go. Thank you. Yeah, I can't read that. As you all know, my name is Tony Scott. I am the newly appointed Director of Housing and Community Development. I took over from my predecessor on August 5th as she ran out the door on September 5th, and we keep trying to chase her down, but she's mighty elusive, if you would. So, but it's been an honor to serve in this time, and making what I believe to be some great strides, working with the administration on how to improve upon our newly developed program. Our vision and our mission. Our vision is a future where every person in Cuyahoga County, regardless of income, background, or neighborhood, has access to a safe home, thriving community, and the opportunities needed to live, grow, and succeed. That mission is to enhance the quality of life for every resident of Cuyahoga County by expanding access to safe, affordable, and quality housing, fostering vibrant, inclusive, and resilient communities, and leveraging partnerships and resources to drive sustainable development and opportunity for all. That's one of the first things that we did once I came in, work with the team to revamp our vision and our mission for what we believe this department is already doing and will continue to do. So this is our structure. We're small but mighty. I'm going to show that in an upcoming slide where you see what we've accomplished the last few years. I'm going to ask any of my staff that are here in the room, I wanted them to come down just so you could see them and acknowledge them because they're often behind the scenes and you don't get to see it. Any of the housing and community development staff, don't just wave. Please stand up, be recognized. We have. So we have our administrator, Ms. Kelly Glenn. And then she is the glue that holds a lot of things together. We have, under her direct supervision is Robert Given. Did Rob come down? Nope. He's out in the field, probably in this wonderful weather. He is the building rehab specialist supervisor. We also have Katie McNair, a senior development advisor. And then we also have Ms. Kiki Compow, formerly known as Catherine. She decided she didn't like that name anymore and got rid of it. Understood. Thank you all. And then we also have quite a few other staff that work with this team, work under this team, and that's Neil Ammons and Ron Angelo, who are our building inspectors. And then Angela Henderson, Michelle Strickland, and DeRay Broadus also. I'd be remiss if I didn't acknowledge the work that we received, say that differently. Our allies in getting this work done are the the business services team. And so I do see Ms. Laura Sims in the back. She supervises a team that helps us with our procurement. Go ahead. Okay. Procuring, finance, fiscal functions, contracting functions. We also have two other unsung heroes that work with us. Miss Sylvia Davis, she's not here today, keeps me, Vaughn, and Paul organized as much as that's possible with all of us. And then also our attorney, Joseph, I can never pronounce his last name, Balbier.
I've make that so much more complicated. But the amount of work that that one gentleman does, it's amazing. It is amazing. So we're appreciative to have all of them in a support capacity for the work that we do. Now, that having been said, we accomplish quite a bit with a small staff and a small amount of funding. What you see in front of us is our general fund budget. So you see the projections total for 2026, 290,646, and the 2024, 366,834. So I don't think I'm sharing anything with any of you that we're primarily funded through our HUD entitlements, which we did get them this year, but they were considerably late. And you can see those numbers. The CDBG HUD allocation, $4,227,608. Our home investment, $2,581,380.72. That's important. And ESG, $712,826, giving us a total of $7,521,841.72 that we, again, will have the ability to use the beginning of the years when I look at Q1, Q2, putting out an RFP or RFPs. Accomplishments. I'm not
Dr.
going
Scott,
to,
excuse me. Can I ask you at this time
yes, Madam
to
Chair.
highlight anything on the accomplishments page and the looking ahead that is pertinent? Just running low on time.
Sure. Nope, we were in sync.
Thank you, sir.
What I want to indicate is the most important accomplishment is at the very bottom. In total, since January 1, 2024, Housing and Community Development has administered a total of $48,661,784.29 in grants and loans for new development, home repair, lead abatement, and professional services. We're proud of that work. We're proud of that work, but I'd be remiss if, in juxtaposition to the last slide, you see what we're working with. A lot of this, we're in the post-ARPA dollars, so it'll look different when we stand in front of you next year. So, but I do want to point out that I am working with the administration, starting to share some suggestions going forward, and I'll be back in front of you within the next few months to be able to talk about what that looks like a little more thoroughly. I want to be deferential to my leadership that I'm not in a place to communicate those publicly at this time. But they do have my draft of my 90 days suggestions, so we are moving forward, 90-day assessment, so we are moving forward. So to that, in the interest of time and to have time for any questions or answers, I yield. Thank you.
All right. Thank you, Director. Do we have any questions for Director Scott?
Nope, as Chair of Community Development and Housing, I just want to commend Director Scott. He's been hitting the ground running, and anything I can do to support, please let us know.
To the chair, to the councilman, thank you, sir.
All right, thank you.
Thank you.
See you soon.
See you soon.
All right. Okay, we'll now hear from Soil and Water Conservation District, Executive Director, Kristen Hall. And Director, we again ask you, and you got it. All right.
Yes.
Thank you.
I believe there may be some slides available. If not, I'm going to just dive in because we want to keep it short.
The slides are available.
All right,
Just
beautiful.
use the green button.
We'll do both. Thank you. Thank you all. In the interest of time, I'm going to fly through these, but it is not to gloss over our incredible work at Cuyahoga Soil and Water Conservation District. But just to get through it, I will quickly draw your attention to the packets that you received. In the back is our 2024 annual report and 75th anniversary highlights. This includes a lot of impact metrics from our district in 2024. So there may not be a lot of numbers in my slides, but you will find them in that document. My name is Kristen Hall. I'm the Executive Director at Cuyahoga Soil and Water Conservation District, and we like to say we are your soil and water conservation district. Our mission is to foster a healthy and resilient urban environment through soil and water conservation through soil and water conservation practices, community engagement, and environmental stewardship. We are governed by a board of 5 supervisors that are elected officials, unpaid roles that are 3-year terms, and we have 1 associate supervisor. And as I know many other directors have said, I am a little biased, but I would say I have the best staff in Cuyahoga County. They work incredibly hard throughout all of our communities that we serve. We work in the areas of outreach and education, watershed management, stormwater management, and healthy soils and natural resources. That looks like delivering our public involvement and education program, PIPE, student and youth programs, teacher workshops, community outreach events. We've done quite a few, and you hopefully received some of our native seed packets that we've been giving out this year. We have partnered with the National Wildlife Federation to deliver our Sacred Grounds program at houses of worship in the city of Cleveland, and we're hoping to expand that to throughout Cuyahoga County if we can find some additional funding. And then we have, on the watershed side, delivered, we had 2 large stream restoration projects representing more than $1 million in funding that were completed in 2024, Greenbrier Valley on the west side and Mayfield Sand Ridge on the east side. Many of you may be familiar with our Cuyahoga River Area of Concern. We are the facilitating organization for that committee. Over the last couple of years, I think we've really helped to elevate some of the work of that committee and show where the river has come, but also really the great places that it's going to be going as well. Additionally, we work very closely with a number of communities on stormwater management, doing plan reviews, active construction inspections, and then on the tail end, once those facilities are built, doing long-term operations and maintenance inspections, and then working with landowners to try to keep those maintained as much as possible. We are now the administrators for the Healthy Urban Tree Canopy program. You can see in your packets a 1-pager for that program. Funding has been reduced for that in 2026 and 27, but we are very thankful it is still in the budget because we know how many other competing priorities you have. So with the shift to Cuyahoga Soil and Water, we are able to leverage those funds through our state match under Ohio Department of Agriculture. So in providing some of those, we are able to bring in hopefully up to 40% or more funding on top of that. We offer a conservation action grant program to deliver some funding to our residents and community members, very low barriers to entry, small grants, $500,000, but we've delivered over 75 of those in partnership with to align with our 75th anniversary. And then our hope is in 2026 and 7, we're gonna really ramp up our soil health programs and soil testing resources. It's an area where we dabble a little, but I think we can be a much stronger player and resource for our community. I mentioned our 75th anniversary. You'll see some highlights there. It was a very big year for us. I know many of you joined us on some of those events. So we're excited for another 75 years. And then let's dive into the budget, and we'll get through that really quickly. Thankfully, it was nice to see the other departments. We only get $150,000 of operating funds from the county each year, so we are maintaining that. We're not asking for any additional funds, and those 2, as I mentioned, are matchable through the state, those coming from the general fund. And then most of our funding comes from municipal service agreements that we have delivering our pipe programs and stormwater management programs. Oh, I forgot to advance my slides, but you have them in front of you, so you should be okay. And then on the expense side, more than 80% of our funds go to our staff salaries, and then the rest is for general operating, rent, vehicles, printing. We do a good share of printing, especially on the pipe side, which is funded through our service agreements. And then finally, as we look to 26 and 27, we have a number of conservation goals here. I'm not going to read through them all, but mostly we want to be more proactive in our service delivery. So we're trying to improve efficiency wherever possible, implementing standard operating procedures, trying to work with communities on the policy side and planning side wherever possible, and then again, increasing our soil health and healthy urban forestry programs. Please always stay connected with us. You can always find out about what events or service offerings we may have, and I am here to answer any questions as well. Hopefully I got through that pretty quick.
I think you did, and I don't. Except.
All right, I'll
All
get
right.
out of here
Thank
before
you.
they show up.
Thank
Thank
you,
you.
Chris.
Have a great afternoon.
You too. Okay, we'll now hear from the Department of Sustainability, Director Kenter Knowles, followed by Public Works, and then Cuyahoga Green Energy.
All right, thank you. Good afternoon, County Council. I am Melanie Knowles, the Director of Sustainability, and I'd like to give you a quick review of the 2026-27 budget, and then talk about some changes to the Sustainability Department over the last couple years and some select initiatives that we are currently working on. The Sustainability Department's general fund budget is almost entirely personnel. The increase in expenses from 2024 is due to 2 grant-funded positions, the Deputy Chief of Climate and Sustainability and the Freshwater Institute Program Director. We have grant funding for a portion of the general fund costs for those positions, and we will continue to seek additional funding. For the other expenditures line, the reduction from previous years is the movement of all energy and utility-related contracts and services to Cuyahoga Green Energy, which falls under Public Works. Our current dedicated and talented staff includes 4 permanent full-time staff and 1 public service fellow who has a 1-year grant-funded position. We have a vacancy credit that reflects another position in our authorized strength that is unfilled due to the hiring freeze. Since the last biennial budget, the Sustainability Department has had significant changes. Since the creation of Cuyahoga Green Energy, the new public utility, who you will be hearing from, 3 staff have transitioned from sustainability to CGE under Public Works. There are 2 more recent changes as well. First is the transition of the Bring Your Own Bags program from sustainability to the Cuyahoga County Solid Waste District. Since the state of Ohio preempted the county's plastic bags ban, as a behavior change program, BYO Bags is a better fit for the Solid Waste District. A second recent change is the transition of the Healthy Urban Tree Canopy funds to the Soil and Water Conservation District, which you just heard about. The Sustainability Department, the Cuyahoga County Board of Health, and the County Planning Commission continue to serve as part of the Healthy Urban Tree Canopy program. However, the funds no longer pass through the Sustainability Department budget. The new model will improve the efficiency of the program and leverage state matching funds. So new in 2025, we have additions to our program. I'll just touch on a few of those. The Freshwater Institute aims to establish our region as a global freshwater stewardship leader by convening and collaborating with local water leaders to increase educational programming, grow our sustainable water economy, expand access to our waterfronts, and advocate for our freshwater resources. In January, we welcomed Emily Baca as director of the Institute and launched several educational and water workforce programs in partnership with area nonprofits. These programs include expanded water safety instruction for 4th graders from Cleveland and Warrensville school districts, a paid fellowship experience for high school students, and a paid summer internship experience for young adults. The Institute has reached hundreds more individuals through speaking engagements and community events this year. Additionally, we established the Great Lakes Regional Forum with the National Association of Counties and hosted 3 meetings with county leaders from across the Great Lakes. The Sustainability Department has also been collaborating with Economic Development, Transportation, and the Planning Commission on the creation and implementation of the Transit-Oriented Development Loan Program. Transit-oriented development has inherent sustainability benefits. However, there is also incentive for sustainability initiatives such as energy efficiency, renewable energy, and green building in the proposed TOD projects. We will be working with economic development to expand those efforts and incorporate incentives for sustainability into other loan programs as well. Also new is the Municipal Climate Action Technical Assistance Pilot Program. Of the 59 communities in Cuyahoga County, only 4 have had the benefit of sustainability staff. The county's climate action plan, which will be coming before council later this month, recognizes that some climate actions must be taken at the municipal level. And in that case, the role of the county is to support those actions. Funding for the pilot program comes from the Climate Pollution Reduction Grant. That grant funded the update of the county's greenhouse gas inventory, including segmenting that inventory by municipality. So each city has access to their inventory from 2010 to the most recent year of data, which is 2022. The technical assistance has 2 forms. First, we have contracted with Nutter Consulting to assist 4 pilot communities, Beechwood, Brook Park, Maple Heights, and Solon, to understand their greenhouse gas inventories, identify potential climate actions, and select a few climate actions that also support the other priorities of their communities. The pilot communities will receive reports that summarize their process and provide implementation pathways for their selected actions. The second aspect of technical assistance is the development of a municipal climate action toolkit, which could be used by any community in Cuyahoga County. The toolkit will allow cities to step through a similar process to the pilot communities to select climate actions and find case studies and support for implementation. This process has revealed new possibilities for the county facilitating collaborative climate action. And finally, I want to share updates on our key performance indicators. The KPIs in the budget still reflect programs that are now part of Cuyahoga Green Energy. The Sustainability Department has identified more KPIs which support the priorities in the county's sustainability strategy: healthy environment, sustainable development, and to engage, educate, and activate. Those KPIs are available on this dashboard on the Sustainability Department web pages. It still includes the work of related departments such as CGE and transportation, but also the new programs that I just summarized. And I'm happy to take any questions.
Ms. Diamond?
Thank you. To the director, I wanted to get clarity on the Freshwater Institute grant. I understood that that position of director was 100% financed by a grant for the first 2 years, 1 year.
I believe that is true. I said partial, I was including the other position as well. Is that correct? 2 years for.
What
Yes.
years?
The first 2 years.
24, 25, or?
25, 26. Yep. Yes. Oh, I'm sorry. Yes, 25, 26.
And so this budget anticipates what is happening in 27 with this position?
We are seeking additional funding.
From the general fund?
From grants. We are seeking additional grant funding. Or
Okay,
we are looking
so-
for other funding opportunities.
So you're not looking in this budget to fund that position in 27?
I also want, you want,
Sorry.
I don't want to say the wrong thing here. I want to make sure that I'm clear. You may.
It's a little confusing. So the budget reflects general fund dollars.
Please state your.
You could state your name
Sorry, I
and speak into
apologize.
the
I'm
microphone.
Janita McGowan, Deputy Chief of Sustainability and Climate. The budget does reflect general fund dollars funding the Freshwater Institute Program Director in 2027. However, we are still seeking outside grant funding to support that position and are in talks with a local community foundation at this time. So if we receive those dollars, we won't be using general fund money in 2027, but right now it is in the budget as a general funded.
How much of general fund is in this budget for 27?
For the Freshwater Institute
Yeah.
Program Director?
Yeah.
I want to say around, I can't remember. I'm sorry?
Well, what's the salary?
I'm trying to remember.
Okay, sorry.
It's like 105. I don't want to misstate it. It's something around that.
Figures?
Yes, low 6.
Low 6, okay. Thank you. So just, given up several projects that were huge for sustainability when we opened the grid, the green energy now has moved, the trees have moved, the bags have moved. You have a Freshwater Institute now that's, funded by a grant. What else do you have beside this technical program? What are you doing now, just briefly? It just seems like the loan program should be through economic development, and transportation should be with Annie Pease, who is the transportation person. What's left?
Well, first, with regard to that program, absolutely other departments are involved in that and falls under their budget. Sustainability is an active collaborator in those programs, so I just wanted to say that. The economic development component, as well as the municipal engagement component of this, have a lot of potential. We're seeing a lot of gaps and opportunities where increased information, collaboration, education about sustainability can really help to advance sustainability in Cuyahoga County. So I would say expanding on what we have already been working, even the Sustainable Stores Grant that was part of the BYO Bags program has the opportunity to sort of morph into how can we better support businesses in Cuyahoga County to understand sustainability. Of course, that would be in collaboration with economic development. We also have a lot of engagement pieces that we do, and I did not choose to highlight that here. But we have multiple programs where we engage both county employees as well as others in Cuyahoga County. Like we work with the Mayors and Managers Association Sustainability Committee, with the First Suburbs Consortium Sustainability Committee, to try to get more engagement and help those communities to incorporate sustainability.
Thank you, Madam Chair. I don't want to take Councilman Sweeney's question. Do you want to ask about the recycling bins, or do you want me to ask that?
May I?
Yeah.
Through the chair, just the blue cans I kind of got used to using, and I'm a slow recycler, but it makes me feel good that I'm participating while I'm here, and it's pretty easy, because it's a blue can, take your paper, put it in there, take a bottle, put it there, and I'm just a proponent of it, and if there's something better coming, great. If not, I'd like to still have the opportunity to try to do my part through the chair to my colleague and yourself.
Right. We really appreciate the folks who are making the effort to recycle, which is very many people. The removal of the desk side recycling bins came because there was such a high level of contamination in those containers that it was not actually, a lot of it was not actually recyclable. So we had a team that was looking at this, including Public Works. It was also not supported by the custodial contract for this building to be taking care of bins that were not recycling. It was intended only for paper recycling. So we are happy to work with any department that wants to do more recycling if they need something different. That's why we placed the stations so that people could bring their materials to the stations that had bottle and can recycling, as well as paper recycling and also trash. And we are also meeting actually on Wednesday to talk about feedback we have gotten on this program so that we can make sure that people are able to recycle when they want to recycle.
And through the chair, thank you. And I just like the little blue can in my office and the little container right here, because you can see it if you're misbehaving. When they're enclosed, right, you don't know, that's where you can get the contamination. I'm just one person of many, but I just wanted to share that because I was getting used to it and I was actually behaving for a minute, so thank you.
I appreciate your recycling, and I thank you for your feedback.
If I can just follow up, we would like stations back here, if you can, with the labels, because I won't name one colleague who wants to put stuff in there, and I won't call him out. He's not sitting up here, but we need to have a label.
Ms. Simon, are you referring to the
No, I
blue
said
recycle, though? I'm saying the blue
one
for the papers?
Yeah, we have
I'm
nothing.
not worried about, no, I want to make sure, because I was wondering, it did seem like there was a change recently.
Well, we lost our recycling.
Yeah, and that's what we
vacuum.
want to
That's
know.
what I'm going, I go like
Yeah.
this.
But we need labels for at least one of our colleagues.
We
Oh,
will get you a station that has labels on it. You're welcome.
No, Thank you, Ms. Simon. Yeah, and not to call anyone out, but no, we do want to put all of our papers and all that back there, and it did seem like there was a change, so we weren't sure where we were putting them at this time. But is there any other questions for the director at this time? Seeing none, thank you for your
All right, thank
presentation
you.
today. Appreciate it. Next, we are going to bring up Public Works. I believe Mr. Dever is coming up to present.
Good afternoon, members of council. Michael Dever with the Department of Public Works. And last but not least, Mr. Foley is right behind me, but I will be brief. I have a presentation here. All right. Okay, what we do, the Cuyahoga County Department of Public Works provides a safe and efficient infrastructure system for residents, employees, businesses, and visitors of Cuyahoga County. The key function of Public Works Department is to build and maintain public infrastructure and facilities. The services we provide are the road and bridge, maintenance and design services, sewer maintenance services, facility management, the county airport, the animal shelter, internal services such as the county mailroom, fleet, and print services, and licenses and permits. Highlights from 2024-25 is 1801, 1803 Superior, the building opening, Phase 1. The Board of Elections has successfully completed 2 elections now in that new facility, and we're now diligently working to get the remainder of the building completed for HHS to move in the summer of 26. Animal Shelter Annex was completed this past summer. The Men's Shelter Annex was also completed. North Main Street, we just had a ribbon cutting just this past weekend. That was a project that was a long time coming, and we're happy to see that that was completed. We have many other road and bridge projects that were completed over the last 2 years that I didn't list, but I just thought I'd highlight that. And then the EV charging station rollout, Mike Foley's going to touch on that also when he comes up to talk. A little closer, Public Works is made up of close to 650 employees spread over various departments. Our facilities is the largest division, and then road, bridge, and sanitary are the next 2 largest groups. Here's a summary of our budget expenditures overall. Personnel services is just north of $71 million. Other expenditures include from contracts and utilities and other $70 million. Our capital plan for 2026 is going to be $110 million for a total anticipated expenditures of close to $252,372. In 27, you see those numbers also. And we have an asterisk just below there, kind of the breakdown for facility, road and bridge, and airport expenditures. The road and bridge, obviously, we leverage a lot of dollars through the federal and state government to be able to move projects forward. So that's why you'll see a substantial expenditure next year, and then the following year it dips down again. But I assure you it'll continue to grow. We have a few larger projects that are on the horizon, such as the Hilliard Road Bridge, which we do not have fully funded yet, but we're working aggressively to get that funded. Facility capital plan at a glance. These are a listing of projects that we have scheduled that are planned in 26 and 27. In the green are those projects that are funded. And then in the light blue, or the green, I'm sorry, is for 2026. And then 2027, the light blue, if you can see that. We have a whole series of investments for the Justice Center and jail that we are tracking, just to keep in mind that we do have a very large project with the Justice Center we need to make some decisions on in the very near future. But I'd like to just at least be able to capture that I do have some cost associated with the Justice Center if we are going to stay put in that facility, that we need to think about the long-term improvements to it. Initiatives for 2026 and 2027. the Justice Center complex. We're going to continue to discuss that with you and with the stakeholders over at the Justice Center. Mike will touch on the CPRG initiative. The Community Corrections Facility, that's where we, in partnership with the Juvenile Court, they were successful in getting a $30 million grant from the Ohio Department of Youth Services. That new facility will be constructed over at the Metzenbaum facility. We are working through a lot of those details right now. We have a design build contract we hope to put on the street before the end of the year. So that's aggressively moving forward. We have a series of lakefront projects still moving forward. Obviously, the HHS consolidation project will be coming before this council in the near future, specifically about the Virgil Brown redevelopment project. So you will be seeing more of that within the next few council meetings. And then we had a large sewer project also taking place out in Olmsted Township, the Fitch Road sewer improvements. We were fortunate enough to get grants and other helpful funding opportunities to move that project forward. And so with that being said, that brings me to the end. I'm trying to be as brief as possible and then take any questions that council members have.
Director, thank you for the presentation. I did have one question for you that stood out to me. I was trying to pick it up on the sheet. So for the current Justice Center, what was the immediate, was it an immediate need? You're looking for 2026 you need to make a decision by? Or was that 2027? Can you tell us a little bit about that?
What I've done in the 5-year outlook here is that if we are going to stay put in that facility, we're going to need to plan to make some significant investments to it. I know we have not made a decision in regards to if the Justice Center, if they will stay at it, redevelop the current facility, or maybe some other option. As you know, back in 2023, we issued an RFP to see what was out there on the market in regards to potentially a new Justice Center or a redeveloped Justice Center. We have those proposals in hand. We'd like to make a decision on those proposals to at least narrow them down, and I expect we'll do that within the next few weeks here with council's consultation also. So it's either we need to make a decision going forward, or I need to start making investments so it's safe for the public that utilize that building.
Understood. Thank you. Thank you for your answer. Council President Miller.
Thank you, Mr. Chair. Director, on the Community Correction Facility, are we building that facility, and when it's done, are we going to run it?
Yeah, that's correct. And unfortunately, in regards to running it, the juvenile court will be operational of that facility. But we intend to sell the project and build it. And there's the county, or should I say juvenile court and the county, were successful in a $30 million grant from the state. So that is what we intend to utilize to build out the project.
Okay, thank you.
Yep.
Thank you. I see Councilman Jones.
Thank you, Chair. My question is on the jail, the new jail. Do we yet know what the guaranteed maximum price will be, and when will that be?
Nicole English is with me here, and I expect there's another presentation to council in the very near future. But we are right now in the midst of working with the contractor to get to that guaranteed maximum price, and I'm sure you're going to see it as council members before the end of the year.
Will any of that be reflected in this budget? Any of those costs?
Any of those costs? I don't believe so. No, they will not.
Thank you. Any follow-up, Mr. Jones?
Yes.
Yeah.
Okay. The next one, I see lakefront projects as some of the initiative highlights of coming up. Any dollar amounts around that, or what?
Yeah. So this past year, or actually in '24, we initiated the the North Marginal Project, which is a $12 million project, and that was in collaboration with the Metro Parks and a sizable grant from the Mandel Foundation. That project should be completed sometime next summer. There's 2 additional lakefront projects that the first one is that just went out on the street and we just received bids back for is the Lake Clifton connector between Lakewood and Rocky River. That is the estimates that we got back on that, I believe, were $12 million also. So we're looking to move forward with that project. That's a series of different dollars that are involved in that from there was ARPA dollars originally involved in that project. We have some road and bridge. The communities are participating in that also. And so that project we hope to have awarded by sometime in the first quarter, and they'll probably be under construction before spring starts.
All right, thank you, Mike.
Thanks.
Thank you, Director. Ms. Conwell.
Thank you through the chair to Mr. Dever. I just had one quick question, just to clarify. So the green and the blue slide for 26 and 27, we currently have all of that funding in the budget to cover these projects.
So I'm going to ask Melanie to join me also, my fiscal officer from Public Works. But those are the projects that we have funded for 26 in the green, and in 27 are the blue ones.
So are they projects we funded or going to fund? I just want to make sure that the fund.
For 26 and 27.
Okay, thank you.
Melanie Say, Department of Public Works. The green is what is in the budgets for 2026, our general fund subsidy for our capital projects, and the blue is for 2027. So they are in the budget for 26 and 27.
Okay, and for the, another question through the chair to Say, or Director Dever, the HHS renovations, those are not inclusive of any of this, are they?
No, our intent is to go out for bonding.
Mr. Dever, speaking to the microphone, please.
No, our intent is to go out for bonding for that specific project, and we'll be bringing that forward to you hopefully before the end of the calendar year for discussion in committee.
Okay, thank you.
Thank you. Thank you, Director. Mr. Kelly, Councilman Kelly.
Thank you, Mr. Chair. Mr. Dever, so the Hilliard Road Bridge, you said it's not quite funded yet, but do you have an approximate time where that might get started?
We're actively working with state officials to try and make up that shortfall, and that shortfall is sizable. I think it's $36 million. So our hope was to get that project under construction in 27. So we're going to continue to advocate utilizing our lobbyists to try and get funding for that. We have notified NOACA that we may need assistance, so they may consider, it hasn't been decided on yet, that there may take a loan out on the project so that we can pay for that construction. It's a critical link between the three communities from Cleveland, Rocky River, and Lakewood.
Thank you.
All right, thank you, Director. Ms. Simon?
Oh, thank you. A small follow-up question to the women's bathroom in the old courthouse. We were looking at new furniture, and I think Matt was working on that. I walked through the other day. It's a pet peeve of mine.
Sure. First off, I just want to acknowledge my staff members that are here with me today, from Melanie Say, who's the fiscal officer, Nicole English, obviously everyone knows Nicole, and Matt Reimer, who handles all my facility work. And I can't forget Mike Foley back there either. He's an important piece of the team too. So Matt.
Matt Reimer, Facilities Administrator, Department of Public Works, through the chair, Councilwoman. Yes, we have that project designed, just trying to wrap up funding sources and acceptance by all the court stakeholders. It's more than just a furniture project. We have a small renovation plan for that lower level restroom to mainly support the domestic relations operations within that lounge area.
I know. Domestic violence is down there. It's awful looking. But we had this budgeted last year, I thought, in the cycle, and you had a plan. What happened to the funding through the budget for that? If I recall, We already had the furniture budgeted.
We moved in, we repainted the space, and we moved in additional furniture that was from another location but we have not done the full renovation yet.
But you have I thought we budgeted for that last time.
Not for that specific project.
I think we did. So are
Okay.
you looking for money to get new furniture
I'm
in
looking
there?
for clarity on making sure I have all the acceptance from the courts first to have the design complete, and then we'll get the project.
Do you have the money in this budget to support new furniture in that bathroom? I'm sorry, but.
I'm sure we can work a solution. It's a relatively small
Okay,
project,
because
so yes.
this has been going on, and I don't blame you, but where's the plan, in the hands of whom? Does the court have the plan?
They have received the plan, but we brought this back up in the court security meeting last month, and I'll be happy to raise it again with the administrators.
No, and the
brief you
color
offline.
is really dismal, I'm sorry. So, well, I'm going to get involved with the plan, it's got to brighten up a
I'll
bit.
provide you a copy, Councilwoman.
I know, I'm sorry. Okay, thanks.
Thank
Got
you,
to
Ms.
stay on
Simon.
this.
And Mr. Gallagher.
Mike, many moons ago, you gave me an estimate on ADA compliancy of the jail, Justice Center, and courthouse. Jail hopefully be moving. What's the cost for ADA compliancy with the courthouse and the Justice Center, if indeed we're going to even consider staying in the Justice Center and redoing that, which, as you now know, we don't have the money for. Initially, it was $1.4 billion for both projects. So if we're lucky, you've got $400 million, and that, I know, is not going to cover a redo of the Justice Center, which is, 10 years and God knows how much. Why are we playing games with this? Let's make a decision and get moving. The problem that we have here in the county is nobody seems to be in a hurry. And now, we had the money set aside. Now it's not enough. So why are we throwing out there, well, if we redo the Justice Center? We don't have the money to redo the Justice Center. We don't have the time, we don't have the money. But going back to my initial question, just to ADA comply the Justice Center and courthouse, what's that cost?
Yeah, I don't have that number in my pocket right now, but I can provide that to you. We did a general assessment of the building for us to stay put there. So we do have a dollar figure of what it would cost, but we were incorporating that because of, if we are staying there, then there's a lot of the mechanical systems
Mike,
within
I
it.
just said you can't stay there. Why are we pretending we can stay there? The cost is 2.5 times. This is going back over 5 years. 5 years ago, it was 2.5 times more to redo the Justice Center than to build a new building or go somewhere else. How did that change overnight that we're going to consider staying there? And I know there are people that want to stay there, but they don't sit here and deal with what we have to deal with. The reality is we can't stay there, so why are we doing that?
Point taken. I think there's a lot of, I'm not the sole decision maker in
Right,
regards to
and
this,
Mike,
but
I
will
get that. And had you been a
try to
decision
give
maker,
enough information so we can make decisions as we go forward.
I'm
here.
just telling you, it's mathematically impossible because we don't have the money. And I know you know that, and I know that, and the council knows that, and the administration knows that, but we're floating this fairy dust out there that, oh, if we stay there, there's no if. We had 720, Trevor yells at me all the time. I think we had the jail at 700 in Garfield or down in Cleveland. Now it's $1 billion, like I predicted in October or November or October before the election, past election. It's almost 3 years ago. So we went from 720, I say 7, but Trevor says 720, so we'll go with 720. Now we're at about $1 billion, and we're cutting out everything we can, and we're going to pretend we have money for a Justice Center? And I will tell you, that's why the judges are so upset, is they feel they've been kicked to the curb. And I got to tell you, they have. So to float this miraculous, we're going to find $300 million, we're not. So we've got to figure this thing out.
I agree, and this body here will be the decision maker at the end of the day. So I would say stay tuned. There's more
My point in
information
asking about ADA was because when we last talked, and I seem to recall the number around $125 million. That's no programming, that's no ups, that's no extras, that's nothing but ramps and God knows what and everything else to ADA compliant in a building that's fallen down. And that's not your fault. You're not the decision maker. But I can't sit by and allow you to pretend that we're going to go redo that building for $400 million if we have $400 million. So that's all I'm saying. Thanks.
Thank you.
Thank you, Director. That, is there any follow-up, any other questions on that? Appreciate your presentation.
Thank you. Thank you.
We're going to have next, we have Utilities, Public Works, Green Energy with Mike Foley, Administrator.
Thank you, Councilman. I think I'm the last. So.
Last but not least, thank you
not
for
least.
your patience and waiting it out.
It's okay. Mike Foley, I am the administrator for Cuyahoga Green Works, which is formally been in existence now for about a little less than 2 years. We're a division of the Public Works Department. A lot of our budget framework comes within the Public Works Department. But we just in our division, we have a budget of around $450,000. $175,000 of that comes from the general fund to subsidize our work. The rest of that comes from grants that we've got from both the Department of Energy and from the US EPA. Let's see. I get it? Okay, I got it. All right. So we have a small staff, myself, Valerie Katz, who's in the back, is our deputy administrator. Libby Lehman, who just joined us from in September, so she's our senior project manager. Shelby Seberg is a program officer. And then Jay Kennedy, who's the Department of Energy, has given us him for 2 years, so he's in the second year of a fellowship, basically. We have, let's see, hit the wrong one. There we go. Just in terms of accomplishments for 24, 25, we think we've done a lot with a small staff. So the big thing is we won this $129 million award from the US EPA. It's called the CPRG grant, Climate Pollution Reduction Grant. We received approval from council last summer to move forward with our Euclid microgrid project. We are now in the process of finalizing development agreements for a whole lot of solar with the sewer district, with finishing up the landfill site in Brooklyn. So we'll put 6.5 megawatts of solar in a landfill in Brooklyn. Metro Health, their campus in Brooklyn Heights, we're going to add a megawatt and a half worth of solar there. With our microgrid project in Euclid, we're going to be putting 5 megawatts of solar there. City of Cleveland is part of the CPRG grant. We're finalizing a contract and bringing that to you soon for 10 megawatts that they will be developing at the jail site. We're still figuring this out, but minimally 1 megawatt, probably up to 3 megawatts of solar will be going there. And then we have two high schools, one in Maple Heights and one in the city of Cleveland, where we'll be putting solar on rooftops there. As part of this, especially this federal grant, it's been pretty complicated. Well, we got $129 million from US EPA. The whole project is closer to $200 million, and we're relying on federal tax credits. The Trump administration has thrown us a lot of curveballs, a lot of them in regard to this tax credit work. So we've had to safe harbor, for tax credit purposes, purchasing a whole bunch of solar panels. So in August, with little time works, we were able to purchase 10 megawatts of solar panels just to make sure that our projects are safe harbored for at least 5 years. So that's been helpful. And then lastly, as Mike said earlier, we've been able to start putting in EV charging stations at Huntington Park Garage. Harvard Road Garage just started last week, so we've got publicly available EV charging stations, and we'll have more at the jail site as that gets developed in a couple years. Just in terms of work for the next couple years, this is really going to be around implementation. We've got a lot of implementation projects to do. So the sewer district and Metro Health, we're hoping to have solar panels up and ready and running by the fall of '26. The school districts, the same time frame, end of 2026. The Brooklyn site, hopefully early 2027, we'll have panels up there and running and operating and generating electricity. Euclid by late '27. The jail schedule will follow kind of just the jail development site. We do have some time frame issues we need to make with that, especially around, because we've got some extra, we were able to bring in 2 extra megawatts of solar, and so we have to figure out just kind of for tax credit purposes how to get that in and get us under the safe harbor provisions. But generally, we feel like the next couple of years, it's really around a lot of implementation work. Our Euclid microgrid project is, we're right in the middle of doing engineering now. We think we'll have engineering done by the end of '26. Hopefully, construction starts by the end of '27 on that. And then we've been running for the last couple years this residential solar co-op, and this year we'll be hitting our 500th home in our residential solar co-op. We're putting that on hold for the time being. A lot of that residential solar has benefited from a federal 30% tax credit that has now gone away. So the Trump administration has wiped that out, and so we're holding that off for the time being to kind of see how the market plays out, I guess, and on how solar on the residential side works. But at least the program we've run has been pretty successful over the last couple of years, and we will be celebrating our 500th home that we're putting together this year. So that's kind of us in a nutshell. More than willing to take any questions.
Thank you. Appreciate the information. I did have a couple quick ones, but you answered them with your next slide. I was going to ask about the timeline of the projects. And I know I've seen some of them going along, even in the industry. I mean, I've seen them calling for work for people who have manned some of those, I believe the Brooklyn site. What you said about the EV charging stations, was that, did you say how many total do you think there would be?
So we'll have 4 ports over at Huntington Park Garage. We've got 2 there now, 2 more coming. Out at the Harvard Road Garage, we've got 4 ports there. And then at the jail site, we'll have fast chargers there. I think it'll be probably 10 ports there. I forget the exact number.
And those will be like public use as well?
Publicly available, correct.
Yes, that's, wanted to clarify. With that, I see Mr. Kelly, Councilman Kelly has a question.
Thank you, Mr. Chair. So I saw in your presentation agreements. I saw there was a school that had their, how do you get those agreements? I mean, where does that come from?
It's between us and them. We'll be bringing those to council over the next, 3 months or so. We've got a series of them coming that we will ask you for your approval for. But
how do you develop that? I mean, in other words, North Olmsted's got a brand new school that's starting to be built.
Yeah, so we're actually working with the city of North Olmsted on a separate solar agreement for their city hall, just so you know. But on the schools, we worked with the Ohio Schools Council, and the Ohio Schools Council had put out kind of an RFP or an interest letter to school districts to apply to become part of our kind of school solar co-op. We had 5 initial off-takers. 3 of them dropped off. North Olmsted wasn't one of them at the beginning, just so you know. So we've got 2 now, Maple Heights in the city of Cleveland. Part of that is because we've got federal funds from US EPA and from the Department of Energy. The US EPA money was taken away from us. So we had a $1 million grant from US EPA, which we've now lost. So we've got about $600,000 of grant money that is being basically divided between 2 schools.
Thanks.
Thank you. Council President Miller.
Where it says City of Cleveland 10 MW's jail site 1 to 3, is that the county's new jail, or is that a different site?
No, that's the county new jail. MW is megawatts, I'm sorry.
Right, and where it says City of Cleveland, where is that?
So there's 7 megawatts at the Koltoff Road landfill outside of the airport. And then the other, there's 3 megawatts roughly over at the West 11th Street landfill in Old Brooklyn.
Okay, thank you.
Great, thank you. Is there any further questions? Seeing none, Director Foley, thank you for your presentation. Appreciate that. And that will conclude the budget hearings for today. I do want to mention on Wednesday, November 12th, we have Committee of the Whole scheduled from 1 to 5 p.m. We will have additional department hearings if needed, discussion of budget amendment concepts, departmental appeals, and public testimony. And with that, there's no miscellaneous business. Meeting is adjourned.